Welcome to Unscrew the News. It's Bruce Scholl, and I wanted to say to you that I am so grateful and honored to be presenting as much as I can. And I know I missed the last few days, but it's day 7 of the world's greatest health show as Shawn Buckley travels across Canada, taking the petition and creating a charter. Let's hope that he is successful. Let's give him some support, and they are looking for donations, obviously any help that they can get along the way. And so tonight we're gonna jump in here while it's already in progress. This is Lorraine Benoit, it looks like, and she's a consultant, educator, and author. Very interesting so far. I hope that you can listen in and gain some knowledge. I have gained so much just from the days that I've listened to it. I hope that you appreciate and are able to share with your friends and family. Great information. There is the recorded versions down below. You can access their website, obviously, at the NHPPA.org. Just go to the website if you want to find it. But for now, I appreciate you joining Unscrew the News as we restream. This is the world's greatest health show. This will be on tonight, probably in about till 9:30 tonight. So right now it's a little after 4:40. So it should be on for another 5 hours-ish. And so share, make sure to get some more people to watch this. Some great information that's been kept from a lot of Canadians. And I won't keep you any longer. We'll get right to it here. And thank you very much for tuning in. Support our local businesses. You can go to the website, unscrewthenews.com, and support local business. Thank you very much for being here, and enjoy the show.
Because most companies get their herbs from some other company and they just put their label on it. Not that many companies get them from actually the parts of the world where those herbs are the strongest. Most companies aren't able to test them in their lab and test for organics and pollutants and heavy metals and things like that. And it's not just getting rid of those things, but it's how strong is it? Was it picked at the right time of the year? Was it dried properly? Was it stored properly?
Digressing a little bit.
Yeah, you are. That's true. But it's just Health Canada is not helping anything because they're driving customers into getting suboptimal products.
Right. So just to sum up that last point is if the Canadian businesses weren't being squashed with these regulations and being told they can't make this and can't have that, then we could have locally made products that, you know, are of quality we can trust, and people don't have to order online from the States and get, you know, products that you know, in some cases are just not as good.
Right. And plus you'd be building the Canadian economy. We have a lot of local herbalists. One local herbalist, the last round of regulations, it was going to cost her $39,000 to get one product approved. We went and met with their local MP at the time. He didn't even, forget that one. I won't go there.
Yeah, but you raised the point is, I mean, you know, we used to have so much more innovation. We used to have way cheaper products. We used to have products that worked better because Health Canada would tell, oh, you have to reduce this, you have to reduce that. Like, so I had some manufacturers saying, I'm not going to make the product anymore because I know it's not going to work. And I don't want to sell a product that isn't going to work. Like, so the whole thing's been a train wreck. What is, I'll just final question to you. What is your message, Lorraine, to Health Canada or to Ottawa? Because that would include our MPs.
I think they need to quit trying to control every aspect of every Canadian's life. I think they need to start trusting that people have some brains to be able to choose what works for them, what's right for them. People need to have choice. That's supposed to be in our Charter of Rights, isn't it? Choice for healthcare, choice for choice. And I think they have to trust that people are going to try, because we're still at the point where people communicate with each other. somebody gets something that works, they're going to tell somebody else. Somebody gets something that doesn't work, they're probably going to do the same thing. There's research with, you know, the internet. There's no lack of research available. There's so many people are choosing the natural methods of going. There's so many more trained people in natural health now, which we need as our health deteriorates and deteriorates. I mean, it's just health of Canadians is going down. Longevity is going down. Drug costs are going up. Obviously, something's wrong. And if they could just trust that people are going to find what's the best choice for them. And personally, I feel government needs to get out of our personal lives, because they're not making our health better. They're not making our economy better. They are destroying people physically, financially, emotionally, and spiritually with their interference in every aspect of our life. If they really want to do something, they could focus some of their energy, instead of going after natural health products that help people, they could focus some of their energy on working on side effects from all the chemicals that they're promoting all the time. They could be focusing some of their energy on stopping the advertising that's pushing drugs, that's pushing dangerous, unproven vaccinations. And I don't want to get into that whole issue, but
No, we're not. We don't want to go there either. So
no, we don't. But they need to be looking at health, not the financial benefits of big pharma. And until they do that, they should close shop.
Thank you for answering that question. And so that'll end our interview today. And I'd like to just say, on behalf of the World's Greatest Health Show, thank you so much for coming on and sharing your experience and wisdom with us.
Well, and likewise, I would like to thank you, Shawn, for all that you've been doing, the years and years that you've been doing it. I pulled out a file of some of the letters that I have written to Health Canada since 1993, because that's how long I'm aware that they've been trying to stop people from having access to products that heal.
Yeah, hopefully we can bring some meaningful change. Thanks again, Lorraine.
Thank you.
So let's talk about Section 17, which basically puts an onus on people being regulated to cooperate with the Ministry of Wellness when the Ministry of Wellness is trying to check and make sure that you're following the Act and regulations. So when they show up at your facility or your place of treatment, that you have to share your records with them and show them around and let them have access to things. And this is necessary in a regulatory environment, or else inspectors will never be able to determine if, you know, the Act and regulations are being followed. Now, it is a little different than a similar power that's found in the Food and Drug Act that Health Canada inspectors have. And the difference is this, is our courts have said that when any inspector, whether it's dealing with food and drugs or any other regulated activity, is if the inspectors form the opinion that you have committed an offense and now they're trying to get evidence to convict you, at that point, actually your constitutional rights kick in and you're no longer under an obligation to assist them. And we've set that out in Section 17, just so that the people being regulated actually understand that they have these rights. So it creates an obligation to cooperate, but for when it would be inappropriate, you know, in light of our constitutional protections. Welcome to the world's greatest health show. My name is Shawn Buckley with the Natural Health Products Protection Association, and I'm very pleased to have with us Sonia Palmer. Sonia, welcome to the health show.
Thank you so much. I'm happy to be
Now,
here.
people watching are going to see behind your name CHFA. Do you want to share with us what is CHFA and what your role is at the CHFA?
Sure, thank you. So CHFA is the Canadian Health Food Association, and we represent about 1,000 members across Canada, a little bit more now, about 1,200 members across Canada, namely in the natural organic wellness sector. And from my own position standpoint, I'm the Vice President of Government Relations and Regulatory Affairs. So what that means is that I primarily represent the interests of trade. So I do a lot of advocacy work, a lot of grassroots, a lot of discussions with members of parliament on, the impacts that occur when regulation changes or there's changes to legislation that impact natural organic wellness products. That has led to a lot of discussions on natural health products as of lately because of the amount of change that has been proposed for this sector. So a lot of my focus has been on, defending the interests of industry based on these regulatory changes.
Right, and just, so that people fully understand what you're referring to. So, when you guys say members, like people that manufacture natural health products and, organic food producers and things like that, like it's the industry, you've got a lot of industry members. And so when there are problems with the regulatory environment, they let you know so that,
100%.
you can kind of advocate on their behalf. So when you're sharing with us today, I mean, it's from on the ground being told, listen, this is happening and that is happening.
Exactly, absolutely. We do represent actually from the manufacturing level, in some cases, even the supply level, all the way to retail. So we are one of the largest trade associations to represent essentially the whole manufacturing and retail chain, supply chain for this sector. So we do get a very broad amount of information back from members on what the impacts are from the base all the way to sale.
Right. Okay. Yeah. And I just wanted people to appreciate, like you hear from industry that here's the problem, because we're going to be going into, kind of some specifics of some things so that people understand the regulatory environment better. One thing that I wanted to maybe start with is, I don't know if the public's aware, but whenever we're dealing with the regulation of natural health products and Health Canada, so whether we're in the Standing Committee of Health, whether we're in the the Red Tape Committee, as it's called, invariably Health Canada is going to come and present. There's basically the sky's falling. So many people are being harmed by natural health products. Risk. We risk, danger. And you've kind of had to deal with that actually, by looking into it. And so I'm wondering if you can comment, what your thoughts are about, this so-called danger, where Health Canada tells us we need ever stricter regulations because of danger. Because I know you guys have looked into this, and I'm wanting you to share about that.
Absolutely. So I think fundamentally, one of the things that we really had to take head on very early on was the fact that much of what Health Canada has proposed has been driven by what they have said is health and safety reasons. And so a lot of that actually was attributed to things like adverse events and, numbers that were presented in committee. There was an audit report back in 2021 that was presented as really kind of reflecting that there needed to be amendments and regulatory changes that needed to occur. But then how Health Canada actually presented the information, how this actually ended up getting shared in committee, was something that we really needed to get ahead of and a hold of in terms of how this sector actually impacts the health and safety of Canadians and whether or not these products actually presented as big of a risk as what was being proposed. So we did end up engaging Deloitte specifically on a study because of the fact that they had a number of pharmacovigilance experts on their team that were able to actually take Health Canada's data itself and use its adverse event reporting database to give us information about where a lot of this was coming from in terms of, scouring not just that, but medical journals, the internet more broadly in terms of Canadian data was analyzed. And I would say at the broadest of levels, what ended up coming out of that survey or that report was that these products are generally safe. It is what we have been saying, which is that, that these products are providing benefit, they are safe, and that, the numbers that Health Canada were explaining or were sharing were not exactly appropriate in terms of causality and in terms of, the extent to which Health Canada had shared was really contradictory to what Deloitte had found. And so it was a very important step, obviously, in our advocacy and in really kind of making sure that members of Parliament and other parliamentarians, even that Health Canada, understood its own data appropriately.
Right. And I want to unpack that a little more, just because people might not understand even,
Sure.
say adverse reaction and that. So,
Yeah.
Since 1965, we've had, and it was in response to the thalidomide disaster, we set up what was called an adverse reaction reporting system. And so, it's primarily medical people, but it was also set up so that ordinary people could just file a report. So if they thought that, a drug, and drug includes chemical, it includes natural. So, basically if a health product was suspected to have a role in, an adverse reaction or, including a death, that could be reported. And it was just kind of a way of looking to see if there's a pattern that was something should be looked into. But first of all, there's a problem if a report's filed, and Health Canada would agree, except when it comes to natural health products. Well, just because a drug's associated with an adverse report doesn't mean that it's the cause. You would have to look in deeper. So for chemical drugs, you can have all these adverse reactions, and Health Canada will say, yes, but that's not causation. But it should be a signal for them to look deeper.
Yes.
Although it seems that if there's a natural health product, there's a report, all of a sudden that's like more than causation. Like that's fair to say, isn't it? Like there seems to be a double standard.
Yes, like I do think, and fundamentally, that's exactly it. It's not meant to be a driver for regulatory reform, and you are not meant to use that database as, an indicator for causality. That was also very clearly explained in the Deloitte report, was that, a lot of the, on top of the numbers that were coming out, so it was data from about 2020 to 2023. And so they were using numbers like 700 or 1,000 serious adverse events. But what that data actually had shown was that a lot of those, you could not determine that the natural health product was the cause. Many of them were taken, for example, with other pharmaceutical products, or it could have been cancer patients, they're undergoing chemotherapy. It's very difficult to determine that, let's say, your vitamin C was the cause when you were on chemotherapy or other. So much of what we had seen was that causality could not be determined, and that the NHP was not necessarily always the determining factor in these cases.
So I think, and you're free to disagree with me, but I think it's actually, I want to use the word disingenuous, Health Canada, because they know that the safety profile of chemical drugs, is very poor. Like in the Western world, one of the leading 5 causes of death is taking, chemical pharmaceutical drugs as prescribed. So it's one of the riskiest things that we can do. And they also know that natural health products are, below what's called the ultra safe line, like that you shouldn't be regulating them at all. So when they're like scouring this adverse reaction database to deliberately use it as you're not supposed to use it. Oh, wait a second, a cancer patient with stage 4 cancer that's, expected to die, like there's no way this person's going to live, and they're on chemotherapy and other chemical drugs, but there's a bottle of vitamin C there that you could possibly consider vitamin C as a causal factor in their death, which is what Health Canada does. This is what you're talking about. You're trying to grasp straws in the wind to find risk. Like, am I overstating it here? Because we could talk about, I want to bring up Cava next, like,
right. Yeah.
as a real life example.
I think in the scenario and the kind of political environment that we were faced with, over the last, I'd say 2 years or so, what you're stating is appropriate. I do think we've had discussions. We've had to have direct discussions with parliamentarians and with Health Canada directly to really kind of, point that out. We did an access to information request, which, reinforced what we had found in our Deloitte study. And I just think that, there was a strong political will to advance the changes that were proposed, the regulatory changes that were proposed. And one of the most important driving factors that Health Canada can base that on is health and safety. And so there was a very strong pull towards suggesting that these products were unsafe, because that is what will drive that regulatory change. And so that's really what we tried to get ahead of and ensure that Canadians aren't fearful of the things that are providing health benefits.
And I just want, to get you to go into a little more detail, because I actually think you did a real service here. So what Canadians don't know, there was a bill working its way through Parliament, Bill 368, to kind of change how natural health products are classed. So it's in the Standing Committee of Health, and some people from Health Canada basically testified in front of that committee, saying that there was this large number of adverse reactions connected to natural products. And so the CHFA, you guys did an access to information request. So just so people understand, we have a law called the Access to Information Act, where you can make a request and the government's obligated to share the information with you. So you guys say, okay, you've said there are this number of adverse reactions in the Standing Committee of Health. Please share with us the data that's based on. That's what you guys did? That's
correct. Yeah.
And what did you get back? Because people need to hear this.
Ultimately, I mean, when they realized that there were statements made that this had come out in committee, they tried to essentially rebuild the data. So they reran the search because they didn't have anything on file that suggested or that had, basically backed what they had said. And so they recreated the data, essentially saying, here you go, here's the data that you can look at. And so that's what we used in part to identify the lack of causality and the mixing of other pharmaceutical products, et cetera. But essentially the department was stating that they did not have this in writing, or that the proof of this 700 to 1,000 was not something that was within their briefing documents. It was really something they had to recreate, and that we had to fine comb through to determine whether or not these products were actually a health risk or not.
No, I'm going to unpack this more, because what you did, in making this request is so important. So in committee, when, the MPs are having to make important decisions on what do we do, how do we regulate natural products, we have Health Canada throwing big figures out, saying, yes, this is how many people have been hurt. Like, this is the message. This is how many people have been hurt. Please, yes, MPs, protect us. And that was fraudulent. It was made up numbers. They didn't have any data to support it. Like, that's first point, right? You learned that.
I think, it wasn't so much fraudulent as it was exaggerated. So in the sense of taking the numbers and stating that this was the cause, like that was the leap that was made, that was completely inappropriate. And like that really put members of parliament they were uneasy. Like there were some members of parliament that were like, you know, we hear you, we understand everything you're saying, and that you're saying that there's not much risk attributed to these products, but we're not sure how to read this data. We're not sure how to respond to this, because they have, you know, Health Canada's chief medical officer and other very high-ranking officials sitting at a table stating that these products are not safe. And so, like, we had to have very real conversations and really provide proof that, you know, this wasn't the case, and that, you know, generally speaking, that is exactly what the report stated. These products are safe.
Right. So you're being kind.
Low risk category.
You're being kind because you want these people to still talk to you. So, and that's fine. So but you know, in my world, when people say something in committee,
yes,
and they don't have the data to back it up,
yeah,
and then when you do an access to information request and it basically comes out during that, well, yeah, they didn't actually have the data, so we've recreated it because of your request. So here's what we've come up with. They didn't have it before, so that really was they're pulling it out of the air. They're giving concrete numbers. They're giving specific numbers that don't have a basis in reality, but they recreate this because, oh, CHFA's now made a request. We're obligated to give them something.
yes.
So we better, you know, put something in the pot and cook it up. And that data, it doesn't support what they said.
Correct.
Okay, so we'll disagree on what we call that, but at least the public understands that this is what's happening. Like it's my experience with Health Canada is that they try to present this appearance of danger. You know, it's interesting, Sonia, is so we get these regulations in 2004. So before that, you know, we're largely unregulated for all intents and purposes, except, you know, maybe for some monograph DINs on vitamins type thing. So if we were in danger, like 2004, when we're, you know, we don't have Health Canada regs to protect us, that should be when, you know, the dead bodies are in the street. And that's when, you know, a client of mine had Professor Ron Law from New Zealand do a risk analysis, and he got frustrated. He couldn't find any data of harm in Health Canada, like in Canadian government statistics. So he had to go to other Western countries to even find some examples of reports of harm to do his risk analysis. And at the end of the day, like there's this ultra safe line in risk analysis. So if you're not causing more than 1 death per million of the population per year, you don't even think of regulating, because there's not enough of a signal for you to know if you're making any difference. Like you could be making it worse, you could be making it better, but there's not even any point. And we're below that line. Like, and he compared then the different risks at the time, and I've got no reason to believe it's any different. But back then, a Canadian was 14 times more likely to be struck and killed by lightning. And 14 times is a significant amount. Like this is, so 14 times more likely to be struck by lightning than to be, you know, killed by a natural health product. So, you know, and again, 14 times is so much more likely that, you know, the stadium where people get struck by lightning, we can't even park in the parking lot because we're so much safer. We can't even approach the area. So what are we talking about? And this is anecdotal, but it's got to be about 14 years ago now. I'd have to go look at my records. I did an access to information request of Health Canada because I was frustrated. They're always throwing, you know, 28 million people died of natural health products back when our population was 26 million type thing. I mean, I'm exaggerating, but just they've been doing this for a long time. So I did an ATIP request saying, well, let's go. We became a country in 1867. So please give me all data that would indicate that any deaths have been caused by a natural health product in that time. And, and they got back to me quite reasonably saying, of course, we don't have records going back to 1867. But, you know, we did start the adverse reaction database in 1965, and it's pretty robust. So will you amend your request to 1965? And I said, sure. And so do you know how many reports I got from Health Canada back then where they're saying this links a death to a natural health product? It was a goose egg. I got nothing. So, and it doesn't mean that there isn't a risk, but it's not the risk that they're presenting. So, yeah, so maybe we'll just share the Kava example and then move on. And you're aware of this example too. So Kava, it's used as a calming tea. It's the national drink in Fiji. I'll just say that so the country of Fiji, this is their national drink. So if we're going to pretend it's dangerous, I mean, my gosh, don't go to Fiji. You go to Hawaii, there's Kava bars. They're called Kava bars, even though it doesn't intoxicate you, but it calms you. Like, I don't know if you've actually drank the tea, but it calms you. It does. And, I've taken Kava supplements that calms you. And I had another guest on, Sonia, Dr. Eldon Dahl, and Dr. Dahl, and and he was sharing a story where, about basically somebody that was really, really helped by Kava, and I think if I remember the story correctly, was suffering on Prozac. So there's, and studies on how Kava works better than Prozac, which has a really high risk profile. So here we've got Kava on the Canadian market. It's not licensed yet. This is when we're doing this transition. And somebody who was, terminally ill, taking a number of chemical drugs, dies, and they're expected to die. But, the public health nurse notices there's, in addition to all these chemical drugs, there's also some Kava tea. And all of a sudden, that means Kava tea caused the death of somebody who's terminally ill and on a number of chemical drugs. And Kava tea is banned for 11 years in Canada. And you're aware of that story. What are your thoughts about that? That's kind of representative of how they approach this, right?
Yeah. Honestly, I think much of it has to do with the broader management of how Health Canada interprets and manages risk. Like the risk framework that they established, when I was operating there, it was from year 2000. Like, it is a very outdated at this point. I'd have to check if it's been updated since, but at that time, it was very, very based on a precautionary principle in a sense. And so how the precautionary is interpreted can change. It can vary over years. And there's just a lot of room for interpretation when it comes to how to actually manage risk in that sense. And so I feel that a lot of things actually derive from fundamental policies and fundamental documents that the government uses or that Health Canada uses and how it actually manages risk. It's interesting because within that document, there's a lot of discussion around stakeholders and around stakeholder management and getting feedback from stakeholders, because I think one of the fundamental pieces in management of risk is actually working with stakeholders. And so I think sometimes you're at a juxtaposition with actually managing the risk, working with stakeholders that are actually responsible for quality, efficacy, and safety on the ground, and with reputational risks in some cases, right? And it's like, how did we respond to this? Is it appropriate from a Globe and Mail test perspective? Is it appropriate from a public response perspective, regardless of what ends up happening from a health outcome perspective or from a actual risk basis or an industry competitiveness or an industry perspective? So there is a lot that goes into what actually ends up being the response. And in this case, obviously a very strong response. And that is often the case because of the very heavy risk framework that's been created and how it's interpreted.
Right. And I think, you're sharing something that most people want to understand, but you've worked at Health Canada. I know I've worked in various governments, including the federal government in Ottawa. And so Health Canada will create internal policy documents that are then followed.
Mhm.
And sometimes the interpretation can just lead to results that, you know, maybe are intended, maybe aren't intended, but that's part of what happens. You've got a big organization and a whole bunch of personnel in there, and those personnel are told to rely on policy documents, and sometimes things happen that maybe aren't reasonable.
Yeah,
Okay.
definitely.
So another thing I'd like to talk about. So we've kind of talked about, I think we both agree Health Canada really overstates risk on natural health products. One one frustration I have, and I'd like to know your thoughts, is like even during this health show, we're interviewing people that are describing to us really having their lives turned around by natural products, where they've, you know, been in the mainstream medical system. And we're not here to knock them, but the
Mhm.
reality is that's not the whole picture for health in Canada. And like literally we've had people say, I'm only alive because of
Yeah.
these products. And we're interviewing natural health practitioners, so like traditional Chinese medicine practitioners, homeopathic doctors, you know, medical doctors that also use complementary medicine.
Mhm.
But like the homeopathic doctors and naturopathic doctors and traditional Chinese practitioners, we've now
Yeah.
learned during the show, we have to ask them, well, what percentage
Mhm.
of, you know, the people that come to you for help have basically exhausted the mainstream medical system?
Mhm.
And
Yeah.
the answers are no lower than 95%.
Mhm.
So so these natural health practitioners, I mean, they're basically getting people almost exclusively that aren't
Mhm.
finding any help anywhere else.
Right.
And the stories of success they're sharing with us, like life and death stories, are significant. And
Mhm.
I'm just using this as context because what's
Yeah.
frustrates me personally, Sonia, is
Mhm.
that when I have dialogues with Health Canada and when I see how they're approaching things, I see
Yeah.
them overestimating risk,
Mhm.
but it's like they deny that there's any benefits,
Yeah.
right? Like, and not only do they deny there's any benefits, they institutionally have this, they call it failed efficacy. So as a
Mhm.
matter of their policy, they assume that people aren't getting benefits, but
Mhm.
they need to be protected by the risks. And I'm wondering if you can, what your thoughts about that are, because my frustration is if we want good health outcomes
Yeah.
and we say, well, what's the best way to manage these? I think we have to look at the benefits and the risks and
Mhm.
then try to figure out, knowing both of those, what's the best thing for us to do?
I actually have a few thoughts on that topic. I mean, I think that, you know, it's a bit of a complicated topic in the sense that, like, when you actually assess these products, et cetera, like, I think there's no way that we can deny health benefits. Like, they are, you can see that, you know, there is a very long track record of safety and efficacy for a large number of these products, and that's why they're allowed to make claims. We have product monographs that exist, but I do think they're quite pigeonholed in the sense of really kind of being in a very narrow allowance of what can be said. I think that, you know, on top of that, layer that with the fact that there's not much money for clinical trials or research. I mean, you have to compete with, you know, big pharmaceutical companies and others to get funding. So, and just the way that the framework is set up, I mean, you're not allowed to make claims about, you know, Schedule A diseases and other things. Like, there's so much fundamentally that goes behind this question. But I think ultimately, you know, I don't think anyone can deny that these products work, and a lot of them work differently for different bodies, just like pharmaceuticals do, but they absolutely have a place in our mainstream healthcare system. I think they are primarily recognized as being preventative and for maintenance, but that in many cases people actually have found, as you said, you know, life-changing results. And in some cases you'll either see people use them as, you know, like your first step or your last step like I find that's usually how it goes. It's like I may not want to jump straight into something, that's very heavy. Like, for example, a lot of people, I mean, from what we're told, let's say you have mental health conditions or other things, they may not want to turn automatically to a pharmaceutical, and may want to try ashwagandha, let's say, in some cases, or other types of supplements before they get into something that is quite heavy and could have quite an impact on your health. So we see a lot of it through our members as well. I think that it's difficult because a lot of them do say that they'd like to be able to do more research, but that they either just can't compete or there's no dollars for it. So it really has created a very difficult system for our natural health product companies to thrive in, and therefore Canadians to access. And a lot of Canadians actually just turn to the internet to try and figure out how to use these beyond what's been product monographed or what is on the label per se.
Right. So that's actually an important point that I want to get back to, because it speaks more to censorship. But I want to stick first on the first point. Like, we both agree Health Canada will emphasize risk. But, you've personally spent a lot of time speaking with Health Canada officials and, about, let's figure out how to regulate natural health products in the best way possible. And am I right that you have the same experience as me? Like, it's not like they're saying, oh, there's all these benefits. Yes, we have to take that into account. It's all risk. Am I right about that?
Yeah, I would say that's appropriate, definitely. Yeah, guilty until proven innocent.
Right. Except that we like, so you're talking about claims when you're just talking earlier,
Yes.
and basically how Canadians are being forced to go onto the internet because what they're looking for can't be shared with them. Do you want to talk a little bit about that?
Sure. I mean, I think that, in some circumstances, like, it kind of goes back to the product monographs. I think there's been a lot of variations as to how the product monograph system has been used. And essentially what it is a set of tried, trusted, and true ingredients and combinations of ingredients, essentially, that industry can turn to, where, if you, for example, got a vitamin C, you can, specifically state certain claims and health claims, and same with, multivitamins, et cetera, a lot of these, trusted products. And so I think a lot of Canadians will kind of look to the label to understand what they can and can't do, because that's what, you're supposed to do. But in some cases, what we found is that these product monographs, the way that it's worded, can be complicated, or it's not very direct, or, there's circumstances where it's very long wording. So I think a lot of it stems from like that, fundamentally, that it's what like how the user evolves, how Canadians actually read these labels, how they interpret these labels. And so in order to actually stay agile and stay on top of, how the user actually benefits from and uses these products and reads these products, has changed substantially. And those are things that we've really tried to highlight to the government to say, we've even introduced them. I had met, for example, somebody called Jed Looker. He works at the Algonquin College in Ottawa here, and his whole fundamental basis of research is based on the user. So we've actually introduced them to Health Canada when it comes to labeling. We thought that would be a great, case example of understanding and adapting a label to actually navigate it towards how a Canadian would read that and understand that, versus how Health Canada wants to present, the level of risk or what its benefits are. And so there's a huge disconnect, I think, between like the user and the government, in a sense, and how information is conveyed.
That you brought up something really important. So I just want people to understand, like, so when you say monograph system or label claim, so the way it works, just so people understand, is Health Canada will approve a product with a specific claim, and all the manufacturer, anyone is involved in the natural health community is legally entitled to say, according to Health Canada, is the claim. And for things like, single ingredients like vitamin C in that, there are pre-prepared monographs. So it says, if you're going to sell vitamin C, in this amount range, and with these things on your label, then you can say this, so whatever you're allowed to say for vitamin C. And there could be more things you're allowed to say than one. But so that's what just so people understand when you say monograph. Yeah, and you can go and look those up. They're online. So there's certain, so you don't have to apply for a license. You can just use that monograph. But if you're creating a multi-ingredient product for which there aren't a monograph, you go through this, it's a much more stricter process, but they will approve a claim and you're limited to that claim. But what's happening is because that's not very much information for people on the ground, people are going out and doing their own research to try it. So it's kind of this censorship is, I think, backfiring, Sonia, because the manufacturers will have a whole bunch of information. And sometimes the product will be made for something different than their label claim. I know that from licensing. Like when my firm used to do licensing, the question was, what can we get you approved for? Not what is it for, right? Because the manufacturer wants to get through the approval process. So I think this censorship, although it was well-intentioned, is now backfiring on the consumer.
Yeah, I would agree. I think it's difficult too, because there's just so much information out in the public now, and like access to information, and like, you'll hear Health Canada talk about information disinformation, and like for them truly to be a reliable source, I do think there has to be more engagement with stakeholders. I think that there's been a lot of hesitancy over the years, especially with our sector. It is a cultural issue. It's something that predates when I worked there. I know it is part of why I stepped out of government, was to fundamentally understand like why there was such a gap between this industry and government. But I think fundamentally it stems from not having meaningful conversations with those that are truly responsible for quality, safety, and efficacy. Because I understand that the government puts the standards in place, but it's the industry that makes the ingredients, that packages, produces, imports, et cetera. Like, you are the one directly faced with the consumer, and so you are the one responsible for quality, efficacy, and safety at the end of the day.
I'm enjoying this conversation because it's making me think about, I wonder how this came about, because it could have been very well intentioned, right? One of the, the fundamental purposes in the Food and Drug Act was to prevent fraud, right? Like the snake oil thing, where people are just making outrageous claims about, cure-alls, but really there's nothing there, right? So you're kind of deceiving the consumer. So you can morph into this licensing system where, okay, you can't say anything that you haven't already proven to us. But then that becomes so narrow then. So if you're going to take the position as a regulatory body, well, all you're allowed to say is what we approve. And so you're not actually legally allowed to share bad stuff with us also. Like you're like, there's total censorship. Like, Sonia, I spent good 30 years. I'm really out of the practice of law now, even though I'm still a member. But 30 years, and where half of my practice was running interference with Health Canada. I mean, sometimes in court they actually don't lay charges often, but usually out of court. And I would be hard pressed to find cases where the real problem Health Canada has wasn't speech, whether in writing or verbally. Tied to this, you can't say anything else. But the difficulty is then Canadians can't make proper health decisions. And I think as kind of outlandish as this may sound to Health Canada, that the law should be the opposite. That, like, sure, tell us this is what's proven to Health Canada and that, but the law should be you have to share all health information you have. The bad stuff, the good stuff. Like, I'm frustrated let's say I'm going to take doctor saying my child needs to take an antidepressant.
Yeah.
Well, that company has to provide, 2 sizable double-blind clinical trials to Health Canada showing this statistical separation between the sugar pill and the placebo. And they'll have structured it for a very narrow window and in a very healthy population to get that approval. But on average, for an antidepressant, they will have run 8 clinical trials to get those 2, and the other 6 could be inconclusive. They could show that the drug works great, but the safety signals are too high. They don't want to share them. They show the sugar pill works better than the drug. Like, I think as a parent wanting to make that decision, like, first of all, I want to see those 2 that Health Canada relied on, but I want to see all of them, right?
Well, and I think fundamentally, to be honest, I mean, and this is probably a whole other debate, but we're about to like really get into an era where artificial intelligence makes it really difficult to ignore like lots of data in a sense, right? Where Canadians are turning to things like ChatGPT and other AI tools to ask health related questions and to, just about get diagnosed and to understand, what products they can use and what risks are associated. And so whether or not, Health Canada can keep up with this AI advancement and modernization in terms of, how health is assessed and how Canadians, interpret what they read and what they understand and what they trust is really going to be a primary debate, I think, in the next couple of years, because ultimately, like, Canadians do have access now to much more information, and perhaps some of this is, copywritten or, proprietary information. But the idea is the more and more that transparency comes out and clinical trials are made public or other things are accessible, these are all within reach now of Canadians, and to fully kind of take that decision making and informed decision making onto themselves. And I think fundamentally, at one point, I believe the last time would have been around maybe 2008 or so, maybe around between 2008 and 2013, like Health Canada did have within its mandate the informed choice aspect, and that's changed politically. It's changed over time to really be like a more of a protective role for the health and safety aspect. But informed choice is extremely important, and it's now resurging. Like, it is something that we can't avoid at this point.
Yeah, no, it's interesting. So the world's changing so much.
Yes.
That, Health Canada is going to get dragged along kicking and screaming, whether they want to or not.
Yeah, I think more and more we're going to see cases, and you're going to see Canadians placing pressure to get a better understanding and a better grasp of their health, and we're already seeing it, with the movement of ChatGPT and how people have been trying to take that into their own hands.
I'm going to segue into something else, although this is an important conversation, because I think that really just the way the internet and now AI is going to change our lives, that, any government attempt to try and corral what people can have access to is going to become almost meaningless, I think, is what you're suggesting. And
well, I think at a certain point they will lose the battle of, the being the trusted source. Like, I think, they're going to have to either embrace AI more fully and accept, more and wider, like, there's a lot of policy that's going to have to go behind the use of AI, and that's more generally across, the government of Canada. But I think, like, all of government is going to have to face the fact that Canadians have access to answers in split seconds and are going to have more questions and are, going to want to take more control and have more freedom in how they go about deciding how to manage their lives. And I think that, we're talking very broadly about health and about other things, but I do think the government of Canada has a very big, broad mandate here that they need to take a strong, cold look at and identify what their role is going to be moving forward with such a pressure and such a presence.
Mm-hmm. Oh, no, that's raising a really good point. Now, I want to kind of segue into kind of our regulatory environment again. And then where I'm kind of going is do you think it's made any difference? Because I know you have some really interesting things to say about that. And so just to kind of put it into context for people watching that may not know is, so, if we were to back up 30 years, we, we had regulations, drug regulations that really were designed for novel chemical drugs by and large. So, if you just go to our drug regulations, we've got this approval process. It would start, I think, at C.08.001. And they've got a whole bunch of policy documents there. And those are, they've been changed. But if we went back 30 years, that model's there and we would recognize, okay, here we are. And but then we've got this natural health community just really kind of growing and growing and growing. Like, I don't think, well, when I don't want to date myself, but I watched Gilligan's Island when I came home from school, and the Flintstones, that noon type thing. So we didn't have health food stores in malls.
No.
I can't, I grew up in Saskatoon, and I don't even know if there was a health food store. There had to be one in the city, maybe. And now there's a health food store in every mall. You just, and I think I was in my mid-30s, at least 30, before I heard the word naturopathic doctor or homeopathic doctor. It just, they weren't there. Like when I was growing up, there probably wasn't, it wasn't an option. But it's just grown and grown and grown. And then both the FDA, which is the Food and Drug Administration in the US, and Health Canada, in the late 80s started to notice, wait, now we're getting all these natural products. And so they started trying to apply the chemical drug regulations to natural health products. And it was not pretty, I think, is the kindest thing I could say. Basically they were driving products away and companies out of business, and citizens rebelled. And I'm just giving the history lesson. So they rebelled in the US first in the early 90s, and Congress held hearings. They looked into it, and they passed a law called the Dietary Supplement Health and Education Act of 1984, or 94 rather, where they classified what we call natural health products as foods. There's a subcategory food called dietary supplements, and they don't need government pre-approval. You give government notice, here's what I'm planning on doing, and if there's no objection, off you go. And if you're bringing something brand new in, you are considered a new dietary ingredient, and there's some things there, but by and large, most of these ingredients have been used for health purposes. So that's a small subset. So basically, they kept the status quo, except put limits on what they could say, because prior to the FDA implementing, you couldn't be fraudulent, you couldn't adulterate, you couldn't manufacture unsanitary. And both in the US and Canada, it's not that there weren't safeguards, but you were really like a food in how you were regulated. And we were too. Well, we have our citizen rebellion. It culminates in the later 90s. And just like Congress looked into it, Parliament looked into it. So we had the Standing Committee of Health hold broad consultations, and they come out with these 53 recommendations, which I think they're awful. But when you ask a body whose only tool is regulation, what should we do? They say regulation. But, when I read that report, they're adamant people wanted increased access. They wanted increased access, and don't treat these the same as chemical drugs. So, but we get really what our chemical drug regulations soft. So we have to, for the first time, get government pre-approval. We didn't before. We didn't have to get pre-approval before. The same products in the US don't need pre-approval. Their Congress said that's not appropriate. Let's not do that. So now we need to get pre-approval where and it sounds great. Oh, well, you have to prove that it works and you have to prove that it's safe.
Yeah.
But the safety thing's a farce because we're so ultra safe. You can't measure where they're making any difference. So this happens in 2004.
Yes.
It takes about 11 years before there's a real deadline where you have to comply because we're in this transition period. But now we've been at this for a good decade where for sure we've had to have this. Sonia, how much do you think the Canadian taxpayer has spent on Health Canada to, have us in this drug model?
Honestly, I think from a simple math perspective, because when they came out with their cost recovery proposal, which was essentially, the amount of money that it costs to run the program, it was coming out at about 51 million. So, just easy math's sake times 20. I mean, this is up to $1 billion over the last 20 years to run this program, give or take. Might be less, but the idea is that it's around that. And I think fundamentally the question is how much safer then at that point is this program versus others that don't have an onerous pre-approval, and has that $1 billion been effective in terms of managing health and safety? And I can say that that's very much what we're looking at right now in terms of our next project on, how to really kind of drive reform. I think the results, I can say at a high level in speaking with other pharmacovigilance experts, especially in foreign countries like the US, who have data from, multiple countries, is going to tell you that this pre-approval system is not necessarily what it's been made out to be in terms of health and safety, and that Canada isn't necessarily much more ahead $20 billion later. And so, or sorry, $1 billion later, 20 years later. So I think from that perspective, this is the next narrative and the next story that we have to tell to actually drive reform, is to prove to Canadians that you've been spending a lot of money and the public has been funding a program that has been very expensive, but the proportion of risk is, and where that is, like in terms of pre-approval, looking at things on paper is very expensive. It takes a lot of time. There's a lot of questions involved, in some cases unnecessary questions, and often in many cases unnecessary questions that aren't even tied to the regulations. And that costs a lot of money. And would that money be better spent on a program that is more similar to the States, where more of the efforts are placed on post-market and on the market itself, and on, regulating what comes into the country versus reading what is theoretical and on paper? And that's been a huge debate for us with respect to discussions with Health Canada, with parliamentarians, to really drive reform, because fundamentally we're the only country that does this. And so are we that much safer than everybody else? And at a high level, I'm going to say no. We're going to prove that through the work that we're doing, but I'm fairly confident that we're not safer than others.
Well, just, to have fun with Health Canada, I mean, before the regulations, they weren't saying there were 700 or 800, adverse reactions. But after the regulations, all of a sudden, everyone's going to the hospital. And I know we don't believe those numbers, but I couldn't resist.
Exactly.
But now you're just citing government cost. Does anyone have any idea how much the natural health product manufacturers have had to spend trying to comply? Like I know of some that went out of business because they couldn't absorb the costs. And I know, like I was getting complained to all the time of how onerous and expensive this was. And I know CHFA would be getting the exact same message. Like, has anyone costed? It's got to be a multiple of what the government spent.
It's very difficult, because technically speaking, with every regulatory change that the government makes, they are supposed to do cost benefit analysis, right? Like, you are actually supposed to analyze how much this is going to cost industry. But just as an example, when the government actually pushed through plain language labeling for over-the-counter products in around 2014, they actually lost 1 in 6 products. It costed them over $100 million, and the government estimated that it would cost between $3 to $4 million. So costing this kind of thing is obviously very complicated. It is so exponential, Shawn, that we could never, I don't think, put a number on it as an industry, because it is the costs are so beyond just what they are. And this is, you know, a bigger red tape reduction and how red tape is calculated. But when you actually put things down to the level of policy, because you've got layers and layers of costs. I mean, you've got the idea of, you know, the Food and Drugs Act and fundamentally what that says. Then you take that a level deeper, you've got the regulations. So you've got the natural health product regulations. So let's just say we're talking just about, I'll give an example just about, let's say, and this is a fictitious example, but it's one to give you an idea. But if the Food and Drugs Act basically says things should be unadulterated and should be safe, the regulations will go into good manufacturing practices, which will detail, for example, a little bit more about the facility, what the expectations are for cleanliness. But then you get to the guideline level and you might see things like, you know, this means epoxy floors. This means, you know, something very, very expensive where, you know, companies
which might make zero difference at all.
Exactly, where companies can come in with much cheaper alternatives, and you know that you know, here's how we demonstrate how we meet the regulations. Our floors can be repeatedly cleaned. You know, there's no seams, like we've got a way to show you, but that they say no, because the way we interpret in our guidance documents or in our policies is a much more expensive interpretation. And there is so much of that happens at the policy and guideline level, that to calculate the costs of consultants, of, you know, answering questions that are not regulatory in nature, of, you know, having to make adjustments just to comply, to make sure that Health Canada is satisfied, whether it actually be relevant or not to, you know, health and safety, is a number that cannot be calculated. I fundamentally don't think that that's possible.
And, you know, I think even the example you gave would shock Canadians. Like, you were just talking about a plain label change in 2014, I think it was, right?
Yeah. Yeah.
And the figure you threw out was $100 million that it cost the industry, and a loss of 1 in 6 products.
Yeah.
Where it's just the cost of complying. And people might not think, oh, well, a labeling change is going to have a dramatic effect in the industry, but these things do. And there would be no measurable benefit from that, even though it may be well-intentioned. And this is, you know, this is the thing, is this, I refer to what's happening as a death by 1,000 cuts. Like, you're using this epoxy floor as an example. And it's just what people don't understand is that, you know, the manufacturers and distributors and the like, they are really trying hard, and you could not be more proud of an industry than the Canadian natural health product industry. Like, so many people are in it because their own health journeys, you know, they've seen the benefit and they want to help, and we have world-class products. It's not, we're talking about companies that were already doing super, and they'd be happy to take suggestions and, hey, you know, here's a better way. But we're kind of locked in where it's actually, you know, your whole business can be at risk. You're now having your site license renewal, and, you know, the last time they made you do all these things, but now 5 years later, well, that's out the window and off we go, and you need an epoxy floor and this and that. And we have companies going out of business and it's just license applications, everything. It just goes on and on and on, and people have no idea how difficult it is for the natural health community. So taxpayers spent $1 billion. The industry, Lord knows, but it would be multiple of, like, my guess, if you threw out 20 billion, you're probably low. And this is now reflected in our prices for the consumers.
Yes. Absolutely.
Do you want to talk about that? Because this impacts health, because then low-income Canadians can't access the products.
Yes. I think, and what we've seen, especially with this cost of living crisis, is that Canadians, I mean, they still want access to health products. And we've talked about how important these are to many, many people. But what ends up happening is that many, many Canadians will turn to the cheapest source possible. And so a lot of them will order, for example, off the internet, order from foreign competitors, because obviously our framework is already expensive, not even considering, cost recovery, which is, coming down the pipeline. But just already our retailers and a lot of our Canadian companies are faced with having to compete with much cheaper options that don't have to go through many, many layers of bureaucracy and levels of review due to this pre-market requirement. And so it is reflected in prices, definitely. I mean, I think, you spoke about the industry and how important it is to really be a part of this health and safety discussion. So the industry, from what we've seen, is primarily small and medium sized. Like, a lot of these companies are, smaller companies. There are a lot of innovators. For example, you've mentioned a lot of people that have had, health revelations, or they've come across, something that's meant a lot to them in their own health journeys. And often you will see people with very passionate and personal stories come out and build a business out of, helping people. And so consistently, we have supported members that have experienced that. And so we have had to go to bat, namely for small and medium-sized businesses. Not only that, but this industry has very small margins. So we don't necessarily have the same copyright or patent protections that big pharmaceutical companies have. So when you actually do come to market with something, you might see 20 versions of it, the very next week. And so purposely, this industry keeps its margins fairly low. And so when you bring in considerations around, a already competitive market against foreign frameworks that are much cheaper, and now you've got a cost recovery program that's looking to recuperate costs on the site, it's looking to recuperate costs on the product, on annual fees. You're really looking at exponentiating costs. We anticipate that there will be, a loss of access. We can say with certainty there will be job losses. We can say with certainty that prices will increase in Canada, upwards of 30%. So there are huge impacts that I think people don't realize in this health and safety discussion, and whether or not it truly is beneficial to have this amount of regulatory oversight, and the way in which the regulatory oversight is currently being rolled out. So much of our discussions is exactly that. It's around competitiveness. It's around being fair with Canadians and Canadian companies. And really, we're not asking to be, deregulated or not regulated, unregulated. What we're really kind of suggesting is that, but what we're suggesting is that this needs to be a fair regulatory framework in which Canadian companies can compete. And really, the bazooka for, a fly rather than a fly swatter approach is costing Canadians, it's costing our health. And quite honestly, I feel as though we're handing over the management of our healthcare to the United States or other foreign markets that will take us over. We actually have American companies targeting Canadian companies, or American states rather, targeting Canadian companies and saying, move over here, and sell back to yourselves, sell through these loopholes in which you can have, personal importations and 90-day supplies, so that you can pay taxes to us. Who needs to annex Canada when you can just move manufacturing without moving a thing? Essentially move the idea of the manufacturing and the tax paying, and we lose access to the management of our own health at that point.
I think we need to unpack this, and I'll just, I'm not against we all agree on fair regulation, protect against fraud, protect against adulteration, good manufacturing practices. I don't know anyone who disagrees with that, but this onerous requirement we have, just so people understand. So remember, Canadians, we didn't need to go through this onerous process. And it's costing, so your manufacturer, some have gone out of business, they couldn't afford it. Absolutely. Others have dropped products, they couldn't afford it, but they've got this added cost. They pass that on in their prices, they have no choice. Yes. So Canadian prices have gone up, and that means that Canadians, the low-income Canadians, can't buy them. But the same products in the US, where they didn't impose these strict regulations, haven't gone up. and Canadians can import them from the States. That's what you're talking about. So
Yes.
how can it's not fair to Canadian companies when there's no demonstrable benefit. Like, it's not like our products are safer or
It could be the
purer
exact
or
same
better.
product. Yeah.
They're the exact same products, but because we put this expensive burden on the Canadian companies have no choice but to raise their prices. Well, how do they compete when Canadians can go online and just import? That's what you're talking about. It's so
That's it.
unfair to the Canadian companies.
Yeah. And so balancing, I think with that, like, we're really pushing for reform in terms of, the regulatory framework and how it's currently, being like rolled out at this point, and how, it's being interpreted, et cetera. But part of that is really highlighting, especially where we've had such, tense trade discussions with the United States. I mean, they've already, looked at their de minimis. This really comes down to like these types of discussions. And so, what we've really tried to highlight is that you need to be fair with Canadian companies, and we need to be able to compete. And being able to compete means reworking the framework and making it more accessible for industry and for Canadians at that point.
I think there's another angle here too that Canadians should consider, and I'd like your thoughts. I've had lots of people share with me, like, so you can go and buy products on Amazon, for example, and that's becoming more of a trend, but you're not getting any advice. And I'll like use my wife as an example. She's suffering from migraines, so she goes to the local health food store, and these staff are trained. And so they, you need this type of magnesium and this type of B complex, and just using it as an example. But if she was to go online, you don't know where you're getting your advice. And then there's also story after story after story. You think you're buying a product, a specific brand, but it's a counterfeit. And Sonia, so let's talk about the stores, because I know that, in Canada, the manufacturers have reps, and the store owner knows the reps. They visit, they educate about what's happening and what the products can be used for. And the stores are confident when they order from the reps, they're getting the real product. Am I right about that?
Absolutely. Oh, absolutely. I mean, we have many retailers, natural health product retailers, in our membership. And my heart goes out for those that are fundamentally really trying to, comply. A lot of them do talk about how this impacts their bottom dollar. They truly are. In some cases, we do have some companies that, you're right, naturopathic doctors literally are on site, which builds community. I mean, people go in, they have relationships. There's an element of trust from these people, and that trust goes all through the chain, just as you've mentioned. A lot of these companies, they're longtime companies that have been, tried, tested, and true. I personally take some professional lines of natural health products that I can only get, and I get from a trusted retail in-person source. But it's the notion of a natural health food store, which you mentioned, didn't exist necessarily in the past, but has been thriving, is thriving for a reason. Like, people are going there and finding much more than just a band-aid solution to what could be a minor ailment. In many cases, they're looking at things more holistically. I know, speaking, for example, with the naturopathic doctor that I go see, it's like there's 10 other questions associated with what you may be, displaying as symptoms. And so it is a different way of accessing healthcare, but such a fundamental and important way that has a whole sequence of trust built throughout the framework. And it's not something that I think many Canadians want to see go away, nor understand that is potentially at risk of disappearing.
No, and I so appreciate what you've just said, because one thing I want to drive home to people watching is we have to protect our local health food stores, because it's not just that they're providing products. You actually know they have a relationship with the manufacturers. They know the reps.
Absolutely.
And so not only are you for sure getting the product, but they have this information. They're basically information hubs. So they get trained by the manufacturers on the products. They get staff that, many of them are trained as nutritionists or, have other training.
Yeah.
And this is valuable.
It's extremely valuable.
And it's why I wanted to have this discussion is if we don't actually support our local stores, we're running the risk of losing that. And they're a vital part of this, I call natural health community. They're the go-between between the manufacturers and the consumers. And if we lose them, then we kind of lose this like knowledge transfer. And I would say literal caring. Like, I mean, it's really hard to describe.
It truly is an ecosystem because a lot of it is also based on the consumer. So when the consumers are coming in and they're having discussions about certain things, certain ailments, they'll go back to the industry and the manufacturers, et cetera. And then these products end up being rolled out in their stores. Like it is a whole sequence. So it does keep up to some degree with innovation and with the times. And so like that fundamentally is so important. And that's why we've been so loud when it comes to why stakeholder engagement is so important, because, ultimately like that whole communication chain and that whole chain of trust and that whole thing is at the brink of a collapse potentially, with costs coming in, with regulatory changes that are uninformed. And so when you're not consulting properly with those that actually are part of it and are hugely impacted by what you're proposing, it is primordial to how to actually have those intended health outcomes we've spoken about, right? Like when you're actually developing a regulatory framework, it is at the crux and the base. A stakeholder engagement is one of the most important factors. And so ignoring that or doing that in a rush fashion or doing that in a less than meaningful way basically puts it could entirely collapse this entire ecosystem we're talking about. And that has been what has irked me personally coming out of government and being on this side where it's like, how loud do you have to scream? How egregious do you have to be? What kind of tactics do we have to use for you to listen to us? In what really should be a meaningful dialogue on a regular basis. Like we shouldn't have to scream and have to send 2 million postcards collectively to get attention on such an important topic. Like to me, it's like a lot of the discussions we have with members of parliament, like their eyes open wide and are like, why is this an issue? And how could something so primordial yet so obvious come to this point? And that's what I have so much issue with, is that it's so hard to kind of explain to people what the fundamental basis of why all this is happening is. It's not sensical. And like these are the discussions we have to have because there's so many people impacted by it, across this entire country. And that's what our last and you as well, our last 2-3 years have been.
And it's just interesting because we're having this store discussion and some people may not connect. Well, if we keep getting ever stricter regulations, increasing the cost of the manufacturers who have no choice because the margins are slim, who have no choice to then raise prices, well then Canadian consumers can no longer afford the prices in the health food store, so they're going to go buy cheaper foreign products or fake knockoffs on Amazon. I'm not meaning to knock Amazon, but this has become a thing. Amazon's not there to verify that a product is real. So and then we're going to lose these stores, and so we're going to lose this resource and then this kind of feedback that you've described. And just so people understand, so people are coming into stores and there's kind of a different problem. Well, the stores will ask the manufacturers, the reps, do you have something for this? Because we're getting, a lot of questions about it now. And then so the manufacturers will get experts involved. Well, what could help with this? And then somebody will come out with a product. And here's the interesting thing. And every manufacturer tells me this is like, you know whether a product works or not from the sales. Because if it doesn't work,
Yeah.
people don't buy a second bottle and that product disappears. You know, that's your
Exactly.
double-blind clinical trial
Yeah.
gold standard right
For
there.
sure. Yeah.
Because when you're having to pay out of your pocket, if it's like, wait, I noticed a difference, you're buying it again. But if it works, then every other manufacturers will make similar products, and before you know it, problem solved. We've got competition, we've got different products, and the industry really responds, and we'll lose that if we don't support our local health food stores.
100%.
Now, you were talking about cost recovery, and I
Yes.
I just want to make sure that people understand what you're talking about, because it's an important point that you brought up. So with the chemical drug companies, they get charged fees. So, you know, let's say they have a building they manufacture in, and it's per building, they have to pay a fee to manufacture. And if they're going to label, they have to pay a separate fee. And to apply to get pre-approval for their license, they have to pay a licensing fee. And to renew a license each year, they pay a fee. And these fees are all set out in the regulations. There's nothing secret about them. And actually, most of Health Canada's budget comes from these fees, which, you know, I think is a mistake, I think, in the area of health. Like, this idea of cost recovery came in under the Mulroney government long ago, I think well-intentioned. But, you know, in criminal files where Health Canada has to give me their internal emails and stuff like that, they refer to the pharma companies as their clients. Big problems, because you've got loyalty to those that are paying your wages, right? So, but the idea is Health Canada came up with this brilliant idea. Why don't we now charge natural health product companies that have much smaller margins? They don't have monopolies. They're not getting, you know, the government paying for their products and including them in the, you know, the government-funded healthcare system. They're subject to sales tax and GST, which adds prices, which the chemical drugs aren't. So notwithstanding that we're, you know, different worlds, let's start charging fees for per building for manufacturing and labeling. Let's start charging license application fees and renewal fees. And Sonia, I remember, like, it was, you know, a good 20 months ago. Remember Health Canada had that industry call, a Zoom call about, and there was manufacturer after manufacturer saying, I can't survive this. I'm going to go out of business. I'm going to stop doing business in Canada. I'm going to drop product lines. And that hasn't changed, even with Health Canada coming back and saying, well, we'll reduce the amounts and then kind of phase higher over time. This could be the bloodbath.
This is definitely our number one priority. Cost recovery will put many, many companies out of business, no question. So there's been 2 proposals for cost recovery. It is one of the fundamental things that they're really looking to advance. Cost recovery is really meant to pay for regulatory services, essentially. So the cost of, you know, reviewing applications, doing inspections. It's a lot of costs. It's built into it's quite complex, but it's built into like 3 major lines of fees. One being, you know, pre-market evaluation, one being site licensing, and then a third being right to sell fees, which is basically just keeping your product on the market. But much of the framework itself was built on a drug model for cost recovering. It was not necessarily, you know, tweaked much to represent how natural health products function. And I'll just give an example of that. You know, I'll give 2 lines of products that I can think of that would be put out of business, essentially. But homeopathics and traditional Chinese medicines both have hundreds and hundreds of either single ingredients or combinations of ingredients. And so again, with margins being very low for traditional Chinese medicine practitioner, as an example, for them to have a proper functioning line of practice, they'll probably have 300 to 400 or so products and product licenses. And much of those, so a lot of those could be rare conditions. So if somebody comes in and has something, you know, quite rare, they are going to, you know, right now today, you don't necessarily pay a product license fee or a right to sell fee to keep these on the market. And so they can afford to have keep these like within their line of practice. But if in the future they start to cost hundreds of dollars just to keep it on the market, and in some cases, to be honest, they take a hit on some of these products. It's not even to the point that they're making profit, but they just keep it within the line of practice. But in the future, these are going to disappear. It is to the point where both the homeopathic industry and the traditional Chinese medicine industry have both stated that within 3 years, they will no longer exist from a legal kind of, Health Canada approved licensing standpoint. Very alarming.
Meaning we go underground, meaning we just become
Either
unregulated.
they become foods, like a lot of the traditional Chinese medicines as they stand could become foods. So, like what's very unfortunate and what would happen is they have to drop all of the idea of health claims. Like you're really going to pick up a packet and not sure what this is for. You'll have to obviously work with a traditional Chinese medicine practitioner, but it's very helpful for the practitioners to have information on the label and be able to speak to these products more freely. And so already you've talked about censorship, but this will be even more. And it really just creates regulatory shopping, which, Health Canada hates regulatory shopping. They don't want you to necessarily try to evade, regulations and find the easiest way to be regulated. But that often is what industry has to do to try to get away from very strict and very onerous and very time-consuming processes. So when you look at the cost recovery program and how much it was actually amounting to, we just took a pretty standard example, let's say of a company that has 300, products, and not to mention like many variations create many licenses. Like the way the system is built is in such a way that you for the same products could have many variations and therefore many licenses. So let's say you have on average 300 400 natural product numbers, 300 just for simplicity's sake, you're looking at $100,000, over $100,000 a year in fees. Whereas the foreign equivalents, that's just, one company, and the foreign equivalents are coming in for free, zero regulatory fees. So we're talking substantial costs, and I'm not over exaggerating that amount. That is probably underestimating the amount more than it's overestimating. But those were costs that we costed out with industry, with companies, and in some cases they were looking at $500,000 per year, just amounts that are unsustainable for small companies. And really, does it amount, again, does this regulatory framework amount to a safer, within an already safe sector, does it amount to safer products? And that is, the fundamental discussion that we're having to reform how we actually regulate these products in Canada.
Yeah, and we've already kind of had a discussion. In your opinion, it doesn't, and no one can point to them being any safer. But it's interesting. When we brought in the regulations, another thing that happened was a consolidation of manufacturing, because we've got all this strict, paperwork in that. And so small manufacturers just started going to contract manufacturers, which is a real loss, actually, because if you have more small manufacturers, you've got, expertise more broadly, you'll have innovation more broadly.
Yes.
And, less of a barrier to innovate.
Yeah.
Now, by putting fees on per building, manufacturing and labeling, we will further consolidate manufacturing. So basically, we'll lose manufacturing expertise and we'll really hurt innovation. And for no benefit, for no benefit at all, we'll basically be making us less competitive internationally going forward, because we'll be losing manufacturing expertise, we'll be losing innovation for zero benefit. And where we haven't gone is I think that actually it's less than zero benefit, because as people watching this show, like they'll see story after story of benefit. Well, we take that away from people by adding cost. We take that away from people losing products. Like you've mentioned, people will, like the homeopathic or TCM suppliers will drop those products that don't make money or lose money. That's
Yeah.
already happened in the natural health product field by and large. I've had lots of manufacturers say, I don't make money on this product. And as
Yeah.
it got less reasonable and more cost, they dropped those products. Like in some of them, they'd say, well, we lose money on these products. But we
Absolutely.
know there's a small number of people that benefit. So for ethical reasons, not business reasons, ethical reasons, they were there. But when it got so they lost so much money on the products, they had to drop them to stay in business. And that's already happened in a lot of cases.
Yes. Yeah, definitely.
So, yeah. Sonia, we could go on and on and on. I've just loved this conversation. And I appreciate, and I just, so the audience understands, like, I mean, you're on the front line here. You're talking to manufacturers and distributors and stores all the time. You're talking with government. Like you're coming here as somebody who's like right in the trenches.
Yeah.
And so it just gives authority to what you say. And you've really shared some interesting things. So I'm trying to ask every guest kind of as a final question, what's your message to Ottawa? And that's broad. I mean, I think it's intended to be both Parliament and Health Canada. But so I'm asking you, with somebody that's like right there trying to get things reasonable, what would your message to Ottawa be?
I think Canadians deserve the right to make informed decisions about their health. We can't afford to surrender that control to foreign markets with cheaper, faster regulatory systems, and then yet here at home, put access to safe, trusted supplements and essentially regulate this out of existence. So honestly, I think, these are not drugs. Treating them as such threatens small businesses, jobs, and choices of millions of families that rely on them every day. So my message to Ottawa is clear: cut the red tape and protect Canadians' right to natural health.
Well, I appreciate that answer. And when you were answering, I also thought, I should also ask, what do you think of the Charter of Health Freedom?
From a personal standpoint, I would say that, I support it. I think it's genius in the sense of, getting even above the Act level and making it a fundamental right to be able to have access to natural health products. I think from a CHFA standpoint, there's obviously still discussions around operations and around the industry, but I think fundamentally it makes sense. I think being able to access and having a right to access natural health is very important and something that should be primordial to how we access natural health products.
Sonia, again, I've just so appreciated you coming and sharing with us. So on behalf of the world's greatest health show, thank you so much for coming and being with us.
And thank you for having me, and thanks for all the great work you're doing at NHPPA. We very much appreciate our relationship with you. And, we come at this from different angles, but I think fundamentally we're all in this for the same reason. So we appreciate you as well, Shawn, and your entire team.
Yeah, no, and we appreciate you guys and look forward to together trying to get somewhere much more reasonable than we are now.
Agreed.
Thanks again. Let's talk about sections 18 and 19. Now, section 18 gives the Minister of Wellness the power to make regulations. When you're regulating a whole bunch of treatment modalities under an act, you have to pass regulations for people to comply with and to deal with very specific issues. But section 19, it's an interesting section because it puts a bit of a brake on this for our safety. So the regulations are not supposed to be so strict as to take a product away for non-compliance. And let me just give you an example. So back in 2004, when we came out with the natural health product regulations, all of a sudden, this regulatory burden is being imposed upon natural health products and good manufacturing practices are being imposed. I knew of a herbalist at that time whose products I actually used. And this herbalist would go out into the woods and actually handcraft herbs. Well, what if you had a regulation that specified, no, all herbs have to be grown in, you know, a sterile greenhouse, and we're washing it with this and that? Well, that regulation would drive those wild-crafted herbs off of the market. Now, as providing it's safe for us to access those herbs and that we know they're not complying with that regulation, then why should they be taken away? And so what Section 19 does is it just causes this break in this kind of more reasoned approach so that you basically can't be stifled with regulations that are unreasonable. Good evening. Welcome to the world's greatest health show. My name's Shawn Buckley with the Natural Health Product Protection Association, and I'm privileged. I feel privileged to be here this evening. We've got quite the crowd in Edmonton tonight. We're at Church in the Vine, and this is where I attend on Sunday mornings. So I'm very, very pleased to be here, and I'm very pleased to see some new faces. For those of you who aren't aware of what's going on, we've been marching across the country, and I'm going to share about that and share about what you're participating in. I first wanted to honor the sponsors for tonight. So we've got Health Matters, which is a health food store in Edmonton, as a sponsor tonight, and I'm going to have Kim Humphreys as one of our speakers, and she's going to share some things with you that you're going to find quite fascinating. And Kim's quite a little spark plug. You're going to see this passion for helping people. I'd like to thank Purica as a sponsor of tonight's event. And Purica is one of those companies, they're one of the few companies that still manufacture themselves, and they're absolutely passionate. And I came across their product Recovery, which was their flagship product years ago. I'm very pleased to have them as a sponsor. Natural Factors, I think we all recognize them as a major brand of natural health products, and very pleased to have them as a sponsor. And Judy Rankin of LifeWave, and she's got a booth outside, so please attend at that booth. So those, just wanted to recognize those sponsors. We've been traveling across the land, and the cool thing about this is everywhere, tonight included, this is volunteers that put this on. It's volunteers. It's just people that have stepped up and decided, wait, I want to get involved in this project, in what's happening. And at every event, we've had people come up and speak to us, and it's been life-changing. But it's been very difficult. Now, I'll just share with you, we were in Grand Prairie 2 nights ago, and one of the speakers, Karen Peters, she's just the latest. But I'm getting more and more grieved, and I'm getting more and more upset as this tour goes on. And Karen's story was that she was diagnosed with rheumatoid arthritis. And the doctor basically did the opposite of giving her hope. The doctor explained to her that there is no cure, that you're going to get worse and worse, you're going to end up in a wheelchair, and it's going to kill you. And the doctor put her, I forget what the one drug was, the second drug was a chemotherapy drug. And so weekly, she was to inject herself, and she did. So she's injecting herself weekly with a chemotherapy drug, which just made her sick as can be, like just absolutely sick. So, the drug combination did reduce her swelling. Her hands had been twice the size, and she was able to put rings on again, but didn't solve. Her feet were extremely painful. And, she could hardly walk, and on walks, her husband would end up sometimes carrying her home. So she's still suffering terribly, and for half of the week, just totally out because of this chemotherapy drug. And then just emotionally and spiritually facing the diagnosis of, becoming completely crippled, and then, dying. And so literally, and she would agree with this description, her life was hell. Like her life was hell. And after a year of injecting herself with the chemotherapy drug, she just decided, I can't do this. I can't go on. And a friend had suggested, well, why don't you go see a naturopathic doctor? Now, this was brand new to her, the idea of seeing a naturopath, like, what's that? And so she starts researching, and she's looking at naturopathic doctors, and she comes across one in Edmonton who had been a medical doctor first. So this fellow was a medical doctor, and then decided to train in naturopathic medicine, and was then practicing as a naturopathic doctor. And Karen thought, okay, well, that gives the person a little more credibility. I think at the end of the health show, anyone watching them will not think that anymore. But so she goes and sees this person, and I forget his name, but you can watch her on the repeat broadcast that we have. And she says, so she goes into his office and explains to him that she's got an incurable illness. And the first thing he says is, well, there's no illness that's incurable. And he cured her. just with diet and natural remedies. And he also let her know that the chemotherapy drug that she was injecting her with was almost certain that it would lead to cancer if she continued. And it's just affected me because she was so clear on just how desperate it was and how difficult it was to be facing basically a death sentence and the remaining time here just a living hell. And how many Karens are out there who have rheumatoid arthritis, who are injecting themselves with chemotherapy drugs, and are basically facing becoming disabled and dying? Like how many? 10,000, 20,000, 200,000, 500,000, like how many? And for what? And you know, what is the emotional cost? Like I can't imagine living without hope. And if you watch this online health show that we have, it's person after person after person that, you know, had lost hope and was suffering terribly, and then they find an answer. And every story has a happy ending. Every single story has a happy ending, but because we realize there's people out there suffering, you know, we're grieving, like we're literally grieving over what's happening. And it's making what we're doing so important, because it's actually illegal for these stories to be shared by the people that know them. And I'll explain to you the censorship. You're going to be absolutely shocked when I explain it to you. But the people that know about these stories, you know, so let's just use Karen as an example. Well, her naturopathic doctor knows about the story. And likely the manufacturers of the NHPs she was using, the natural remedies, know about the story. If they share it, Health Canada will hammer them. Health Canada will absolutely hammer them. Health Canada censors basically 100% of health information. I'm going to explain that to you and explain how it works. But to get there, I need to explain the drug model to you. You've got to understand our health system, and our health system, the major part of it is the drug model. And how the drug model works is Parliament has passed a definition in the Food and Drug Act for the word drug, and it defines drug so broadly that it includes anything, absolutely anything that you would either put on yourself or you would ingest, either to prevent illness, so stay healthy, or to treat illness. Anything, absolutely anything. I'm sorry, I'm getting distracted. You look so dehydrated. Can I give you some water? Oh, I just made water a drug. No, it's funny, but you see, it's not funny. So if I, you know, handed her this water, I would have broken a long list of federal law. I want you to understand, because this is important. Water's a drug. Oranges are a drug. Bananas are a drug. Anything used, anything deliberately used, covers everything. And this is by design. This is not by accident. So as I'm sharing with you the world you live in, you have to understand this is deliberate. So they've made everything a drug, and the next thing they did was make all drugs illegal. And how they did this is they passed a law saying, well, you can't sell a drug without Health Canada approval in the form of a license. Now, as soon as you pass that law, every drug's illegal. And then Health Canada grants exemptions to it being illegal, temporary exemptions in the form of a license. So that means that it's illegal in Canada. I'm going to speak slowly, listen. It's illegal in Canada to treat yourself with anything the government has not approved. So if the government hasn't approved it, it's illegal for you to use it to treat yourself. Isn't that interesting? Did you know that? Oh yeah. No, this is our law. This This is why this is happening. So it's illegal to treat yourself with anything that the government hasn't approved, which means that the sole authority for determining what treatments we can have access to, we don't have the right to them, they're granted as privileges. The sole treatments that we can have access to are those that Health Canada says we can have. Now, the third part of the drug model is that we structure our drug approval process so that for anything but the most minor of conditions, like, you know, a toenail fungus, anything but for the most minor of conditions, we make the drug approval process so onerous that the only drugs that are approved are synthetic chemical drugs that had a patent. So in the lifetime of everyone in this room, I don't know who the oldest person is, but in the lifetime of everyone in this room, every single drug that's been approved for anything but the most minor of conditions, with the exception of Primarin, has had a patent when it was approved. In a way, you did know this, because you know if you go to the, let's say somebody here has a heart attack, or you've been screened for cancer and they text you during the lecture, oh, it's stage 4, go to emergency right now, or you have a mental breakdown, whatever it is, we all know if we're rushed to the hospital, the only treatments other than surgery are going to be synthetic chemicals. We all know that, right? Well, this is by design because they're the only legal treatments. And these synthetic chemicals are highly dangerous. If you watch one of the speakers in the health show is Professor Alan Castles from the University of Victoria. I mean, he's an expert in drug regulation and drug policy. And he shared with me when I was interviewing something I already knew. The third leading cause of death in Canada, are chemical drugs taken as directed. Did you know that? Oh, no, come on. The mainstream media is talking about it all the time so that we reduce our usage, aren't they? Oh, no, they're not. No, the third leading cause of death are chemical drugs taken as directed. Now, chemical drugs also are involved in another leading cause of death. So in our top 10, another leading cause of death are highly preventable medical errors, in which the chemical drugs play a major role in that. And most chemical drugs get approved not to treat, not to cure, but to alleviate symptoms. So, but just back to the drug model. So in our world, so everything's a drug. We can only use things that the government approves of, and for all but the most minor of conditions, the only legal drugs, the only approved drugs are synthetic chemicals. And that's why in the government-funded healthcare system, we only have, other than surgery, by and large, there's the odd exception, but by and large, chemical drugs. So, and some of the exceptions are there just to protect us from the chemical drugs. I mean, if anyone shows up at the emergency department bleeding out because they've taken too much warfarin, they'll give you a shot of vitamin K. But, you know, by and large, you know this is true. So, and it's absolutely by design. And so the federal government that set this up, so they put us in a world where it's only legal to treat ourselves with synthetic chemicals. Then they've also basically broken our constitution, because health is in provincial jurisdiction, but the federal government has taxed Canadians, you know, just a rude amount, and then they have these bags of cash, and they say to the provinces, we'll give you this cash, these bags of cash, for health care, but you have to follow our health policy. You have to follow the Canada Health Act, or you don't get the cash. And the courts should have never allowed this. And the provinces should have never participated. Now they're all addicted to the cash like it's heroin. Like we're talking billions and billions of dollars per province. No province can now say no. And all of the provinces deliver government-funded healthcare to us. It's funded by us. I mean, I don't know why we pay for it. Who else is paying the bill? We're paying the bill. But we're limited to chemical drugs. And Health Canada is the enforcement arm for the pharmaceutical companies to basically ensure that if anyone else is treating a condition and they're not a synthetic chemical drug, Health Canada will hammer them. And how they do this is they make it illegal for you to share truthful health information, and if you do, they go after you. So let's talk about the censorship, and this is totally going to shock you. So remember, you have to get Health Canada approval, and when you get their approval, and I'm going to use antidepressants as an example. So let's say you get an antidepressant approved, so you get your drug approved to treat depression. It's not going to cure depression, it's going to alleviate some symptoms. So it gets approved to be used for depression, and we call it an antidepressant. Now that's all the pharmaceutical company is allowed to say. They can't say anything else. They can't share anything else with you, and the same for natural health products. So natural remedies, remember, they're not approved for serious health conditions. So, you know, supports cardiovascular health. That's all you're allowed to say, even though it might do a whole bunch of other things. So let me share with you how this censorship works. And this story is going to shock you. So I'm in a federal court trial, and Health Canada brings in a hired gun expert. And this is a psychiatrist. And all this psychiatrist does is he runs a company that gets psychiatric drugs approved by Health Canada. That's all he does. Day in, day out, he gets psychiatric drugs approved by Health Canada. And I was at this guy examining him under oath for days and days. And, you know, at one point, he just started complaining to me under oath. Anyone can get a copy of the transcript. He starts complaining to me under oath how hard it is to get a new antidepressant approved in Canada. And he says, you know, I've got to give Health Canada 2 double-blind clinical trials showing the drug works, which is true. And now, just so you know, when he says that show the drug works, what he means is in a short-term trial, because they never want to go over 3 months, because the placebo effect works for 3 months. On average, it's petered out before then. So they'll want to be below that time period, because they're relying on the placebo effect too. They're actually worried about the placebo effect for the sugar pill. So it's going to be a short-term trial. It's going to be measuring just symptom reduction. So people reporting a reduction in subjective symptoms. And it's going to be in a population that they've selected deliberately to avoid deaths and other safety signals. So it's not real. And then if there is a statistical separation between the sugar pill and the drug in this measured reduction of symptoms, then we pretend, and I use the word pretend deliberately, then in Canada, we pretend that means the drug works. So that's what he means when he says, he's complaining to me under oath and says, I've got to give Health Canada 2 double-blind clinical trials showing the drug works. And then he goes on and he says, so right out of the gate, I run 8 double-blind clinical trials to get the 2 that show the drug works. Oh, that's interesting, isn't it? Now, the other 6, they could be inconclusive. They could show the sugar pill works better than the drug. They could show the drug works better than the sugar pill, but it has some, uncomfortable safety data. It could be a combination of those things. But he doesn't give those 6 to Health Canada. Now, let me get to the shocking part of this story. It's illegal for the chemical pharmaceutical company to share with you the 6 failed clinical trials. Can I say that again? It is illegal in Canada for the chemical pharmaceutical company to share with you those 6 failed clinical trials if the drug's approved. Because if it's approved, they're just allowed to say antidepressant. Isn't that interesting? If people are reporting to the chemical pharmaceutical company of deaths, or they're reporting, serious adverse reactions, it's illegal for that to be shared with you. All they can say is antidepressant. Now, if you had, let's say, a child who a doctor wanted to put on that antidepressant, do you think you might make better health decisions if you knew about the 6 failed clinical trials? Yeah, the law should be that all data on any drug, chemical or synthetic, must be made available to the public. But
They do this because it protects the chemical drug industry. It protects our government-funded healthcare system, which protects the chemical drug industry. That's where the profits are made, are in government-funded healthcare. You can only access the chemical drugs through government-funded healthcare. You know, people complain about big pharma. Well, where is your access to these drugs? In government-funded healthcare. Are the dots starting to connect here? Our healthcare system is there to market chemical synthetic drugs, because we all know that if we wanted good health outcomes, we wouldn't limit our treatments in our healthcare system to synthetic chemicals that had a patent when they went through the approval process. And in fact, the game's kind of interesting. Like Professor Alan Castles, he'll tell you quite openly, and he does during the health show, that no, our drug laws are to protect intellectual property rights. And before I ever met Professor Castles, I was lecturing the same thing. I was saying, well, our drug laws are to protect intellectual property rights. You have to be in the system for a while before you figure that out. But it has nothing to do with health. And the game is interesting. So when the patents run out, so patent is just if you invent something novel, you can get a patent which gives you a monopoly. No one else can make it without your permission for the life of patent. And in Canada, a drug patent lasts for 25 years. So as long as your patent's alive and you get your drug approved, you can charge whatever you want. No one can compete with you. And, you know, on blockbuster drugs, I mean, you make billions and billions and billions of dollars, and no one can compete with you till your patent runs out, and then the generic drug companies can make the drug, and the price drops like a rock. And then the drug is still made for a period of time, and then the companies get new patented drugs through the process, and all of a sudden, the published research is on the new drugs. And the drug reps are pushing the new drugs, and the medical schools funded by the pharma companies are pushing the new drugs, even though the new drugs might not work as well and be more dangerous. Because we never actually do a comparative analysis in our drug approval world. We could have perfectly safe drugs that are totally effective, but yet we'll approve drugs that are extremely dangerous and are less effective for the same condition. That's not how you get good health outcomes. Unless the patient's told, well, there's these other treatments that work better and are less dangerous, like if we wanted informed consent. So, but eventually the generic drugs, they get stopped, they're not made anymore, many of them, and we call them orphan drugs. And you've all heard that term, orphan drugs. And so what it means is that people my age, if we go to the hospital, by and large, we're treated with drugs that didn't exist when we were born. And when our kids go, when they're our age and they need to go to the hospital, they will by and large be treated with chemical drugs that didn't exist when they were born. Just like our parents were treated with chemical drugs that didn't exist when they were born. And that's the business model. It's all about intellectual property rights, and censorship is the next part of it. Now, how do we feed this machine? Oh, we attack the food supply. So who has control over our food supply? The government, Health Canada, and then Canadian Food Inspection Agency. So, and the media and the education system has taught us, well, just trust the government. No, but I mean, we laugh, but you know, I'm sorry, 20, 30 years ago, every one of us, when we went to the supermarket, we just assumed everything was safe. We all did. Like, you tell me you didn't. No, you did. We trusted them blindly. Oh, because Health Canada's watching us. Canadian Food Inspection Agency is watching us. And yet we're now at this point where they've allowed so many dangerous chemicals into our food supply that I'm wondering, and I'm hoping you're wondering, could our food supply be more toxic? Like, is it possible that you could have more chemicals in the food supply without the population reacting? Like, it's almost like, let's say we were devious and our goal was to poison the population. Just, we're hypothetically speaking. Well, there'd be some line where you'd cross where it's too much and the public would wake up and go, what the heck's going on here? And stop this. But, you know, I asked the question, it's not rhetorically, could we have more chemicals in our food supply without the population reacting? Everyone in this room, if we tested you, you have glyphosate in you, every single one of us. Just to name one, just to name one of the most dangerous ones. So everyone in this room, even if you're eating organic and raw and, you know, like you're that person that doesn't eat the ice cream, like, you know what I'm talking about. Like that, those annoying people that somehow have this discipline that I don't. You have glyphosate in you. And the reality is that likely no one in this room even has any idea what it feels like to be healthy. Because it's like we're on this walking journey and we have so many toxins in us, it's like they put a knapsack on our back with a 100-pound weight. And, you know, we're fine. We're able to walk pretty far every single day. But we don't know what it's like anymore not to have that weight on our back. Because it's weighing you down. There's no ifs, buts, ors. And some of the presenters at the health show, I mean, they became horribly sick because of this toxic overload. Now, you and I may not have, that may have not have happened to us, but we're not healthy anymore. And it's a problem. And so they've added this toxic burden to us. And then I'm going to share something with you, and I know most of you are going to go, that can't be. The guy's just crazy. Like, I'm not listening anymore. But I'm going to put it out there anyway. As crazy as this sounds, the human body needs certain nutrients to be healthy. There, I've said it. Who knew, right? The human body needs certain nutrients to be healthy. And if you're not getting the nutrients you need to be healthy, guess what? You're not healthy. And if it carries on, then you become chronically sick. And then what do? The mainstream medical system doesn't solve your malnutrition. The mainstream medical system treats the symptoms of your malnutrition, which has developed into a chronic illness, with chemical drugs. You know, we're in Vancouver, and Udo Erasmus basically crashes our event. And for those of you in the natural health world, you know who Udo Erasmus is. He walks on water. He's the guy that taught us about dangerous fats and that we need omega-3s and omega-6s. And he walks up to Teresa and says, oh, hey, you know, can I be a speaker? Well, yeah, you can. So he's up there, and you can watch the Vancouver thing. And he also presented for the online show. So, I mean, we've got a long presentation by him. It's fantastic. But he's sharing at the Vancouver live event. He says, listen, there's this list of essential nutrients. This isn't a secret. And you can't live without them. And I'm okay, like, really, like, you need these. And he says, well, that's why they're called essential. Like, if you're missing even one of them, you die. So this isn't a secret. There's a whole bunch of nutrients. Like, you're going to become chronically sick and die if you're just missing one of the essential. We need them. In fact, arguably, if anyone was to deny you access to those, that would be a criminal act, because it's so predictable. It's so predictable that you will get sick, you'll suffer, and then die. Well, the government that has control over our food system, our food, as it used to be like 100 years ago, you could get what you needed. You could get your essential nutrients out of your food. You can't anymore. And the U.S. Department of Agriculture has measured. Periodically they do a survey, and they measure how many nutrients are in our foods. And it's gone down and down and down and down. I think it was the 1949 survey where they're sounding the alarm, and they're saying, well, if you're missing this, here's the chronic illness that develops. And if you're missing this, here's the chronic illness that develops. It's not a secret. This isn't a secret. If you're not getting what you need to be healthy, you're not going to be healthy. So how is it that we arrive in Canada in October 2025, and even if you're eating well, you can't get the vital nutrients that you need? You see, we've given up control. Wouldn't it be better if we never had that, and we were just taught we needed vital nutrients, and then we'd be demanding of our food suppliers that they would provide food with vital nutrients, and we'd have it, actually, they'd be in the grocery store, oh, these carrots have this, these have that. You've never seen that. You can't even shop properly.
And then the industry would be fertilizing broadly to make sure that we've got all the nutrients we need, all the vitamins and minerals. But instead, the government controls it. And we don't have all the vitamins and minerals. And in fact, they're spraying glyphosate over everything, which pulls the vitamin or the minerals out of our foods. It chelates the minerals in you, and it destroys your gut flora. Plus, it causes cancer. And it's in every one of us in this room. So the government, in control of our food supplies, put us in a situation where we have to supplement. So in Canada today, if you're not taking vitamins and minerals, if you're not supplementing, get some professional advice. You need to supplement. You absolutely have to, or bad things happen. I got to share a story that just came to mind. So one of our speakers was a young mom, two young kids at home. And she ends up with what her doctor diagnosed as restless leg syndrome. And what would happen, as she describes, and you can watch her online on the show, she describes, well, she would get it's like she's getting electric shocks into both legs. And it was very uncomfortable. And the only way to stop it would be by walking. Well, then she can't sleep. Every time she goes to lay down, shock, shock, shock. Twitch, 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 and she's got to be walking. She's got to be on her feet to stop it. And she's not sleeping. And she's getting not easier to live with. And her immune system's getting compromised because she's fatigued, and her mood's getting bad, and she's losing the ability to care for her children. She's losing the ability to care for her children because she's walking all night long. And she goes to her doctor. And her doctor says, we don't have a treatment for restless leg syndrome. Let me write you out a prescription for a Parkinson's drug. Well, we had rheumatoid arthritis, Karen Peters, on a chemotherapy drug that was guaranteed to cause cancer. So anyway, the doctor's wanting to put her on a Parkinson's drug. She looks into the drug profile, and she wasn't willing to do it. And then a friend recommends she goes sees a naturopathic doctor. She does, and the naturopathic doctor hello, you need magnesium, and puts her on magnesium, and bang, it's gone. Now, that story, that was one of the earlier interviews that we taped, and I'm sharing that as I'm interviewing people. I might have shared that with you, Dr. Lana, when I was interviewing you, and all of them are getting back to me. It's kind of if you're dehydrated, drink some water. If you're getting muscle twitches, you're magnesium deficient. It could be something else, but that's out of the gate what you're going to get, and likely it'll go away. So the natural health community, it's just known. It's known. It's kind of like I say, if you're thirsty, drink water. It's kind of duh. Well, why didn't the doctor know that? Why didn't the doctor know that? Why is the doctor writing a script for Parkinson's medication that's going to destroy this young mom's life and cripple her and shorten her life and not solve her problem? Why doesn't the doctor know about magnesium deficiency? I've interviewed 3 doctors for the health show. So 2 of them, well, all 3 of them practiced for over 40 years as medical doctors. 2 of them, partway through also became homeopathic doctors. And, one of them became an expert in nutrition, Dr. Rona. I asked them, how much training did you get as doctors in nutrition? I think the most was 2 hours. They're clear, doctors are not trained in nutrition. Okay, let's connect some dots. So the human body needs specific nutrients to be healthy. The government ensures that we don't have those nutrients in our food supply and forces us into a mainstream medical system where the doctors aren't trained to recognize nutritional deficiency, but to treat the symptoms with chemical drugs. This is your country. Now let's get to the fun part where it's actually even illegal for the supplement companies to provide you nutrients in amount for you to actually stay healthy. It's actually illegal in Canada for natural health product companies to provide you with enough nutrition for you to be healthy. And the way this game works is recommended daily allowances, right? We've all picked up bottles. Oh, vitamin D, 2,500 international units, 100% of your recommended daily allowance. You know what I'm talking about, right? We've all seen that. Isn't the word allowance interesting? So the government, this is your recommended daily allowance, like we need their permission? Well, we do. They're drugs. They're being used to treat nutritional deficiency. So they're drugs, and that's why they have to be licensed. But using vitamin D as an example, vitamin D is essential for your immune system and a whole bunch of other things. And not a single Canadian in winter can get enough vitamin D from the sun. You can't. The sun's too low on the horizon. Even if you live in Alberta where it's warm in January and you go outside to get the sun on your skin, you're just not going to do it. It's just the rest of Canada's watching. They don't know how warm it is in Alberta in the winter. But you can't. So you must supplement. You got to supplement. You know, we call it flu season. Right? You all know what I'm talking about, flu season. A more accurate term would be low vitamin D season. It's low vitamin D season. That's what it is. If we all supplemented with vitamin D, we wouldn't have the flu season. We'd just have this, you know. So, but Health Canada only allows 2,500 micrograms of vitamin D. So if a manufacturer, you pick up any vitamin D in any health food store, the maximum dose is 2,500 international units, the same as microgram. That is so below what you need to be healthy that you might as well not even take it. But by law, if a manufacturer tries to provide you the amount you actually need to be healthy, they will be attacked. Isn't that interesting? Yeah, this is fun, isn't it? So that's why we're doing this. That's why we're doing this. So I would like to invite Kim Humphries up. Kim runs Health Matters, and we're going to talk about why you need to support local health food stores. And it's actually going to surprise you why. There's like reason after reason after reason. Kim, welcome to the World's Greatest Health Show.
Well, thank you, and I'm excited.
Yeah, well, let's have a seat and have a conversation. So first of all, how on earth did you end up owning and running a health food store?
Well, we talked a little bit earlier about Udo Erasmus, and surprisingly, he was a very big catalyst for me and my health journey. Back in the 80s, I went to a seminar with Udo Erasmus, went home and promptly threw almost 90% of the food out of my house, threw all my chemicals out. My husband at the time went, "What the bleep is going on?" I had 2 small children, and he was a catalyst for changing my life and helping me to look at what needed to change so that I could have young children that would be healthy. And yeah, so that was kind of interesting that he crashed your party, because
there's some synergy here, isn't there?
yeah, he crashed my life a long time ago. So
it's funny how that happens. And okay, so you end up purchasing Health Matters. So it was already a store, and you decided to purchase it. Now, many people may not understand how health food stores are a resource.
right.
Because the reality is people coming to health food stores, they're expecting advice. And so can you share with us kind of how you ended up training, and then also, you know, how you ensure that your staff is trained and why this is important?
Okay. Back in the day, so before I decided I was going to go back into the workforce, I was teaching some classes for another health food store, homegrown. And at the time, I was very well learned. I spent a lot of time studying. And so I would teach the classes, and they'd say, "Well, do you have a health degree?" And I'd be like, "No, I'm a self-study." I homeschooled my children at the time. And so I spent hours learning and immersing myself in nutrition and lifestyle. And so I felt, okay, I need a degree. People don't want to listen unless you got a degree. So I went and spent 2 years getting a degree. So that was a catalyst for when I did buy the store, that I really wanted my team to have some grounding, some background, because it really made a difference.
And that was a Bachelor of Science in Nutrition.
Yes, it
that
was
you
a
got.
Bachelor of Science in
Right.
Nutrition.
And then there's regular training of your staff, and
Yes.
you probably also hire staff that's already trained.
Yeah.
And then there's ongoing training. Can you share about that a little bit?
Yeah, so I feel that for us to be a good resource for you, it's really important that we actually know how the body works and what those essential minerals and vitamins that are needed and what are some good sources. So that was part of why somebody that works for me needs to have that really good foundation so that we can make recommendations that are going to be effective. And there's a lot of really good schools out there. So I try to source my team to have those credentials, and then we just build on it. We do trainings every month. A lot of our really good vendors have really excellent trainers that are biochemists. They are the scientists. They are the catalysts behind these new innovative products in the health industry, and they come and they actually train us. So we're getting it really good science-based information, and that allows my team to be able to assimilate it and then say, hey, we know what we're doing, because we even get more ongoing education, plus we do our own.
So I'm just going to follow up on the vendor thing, because I think a lot of people don't understand that in Canada, our manufacturers, and I can tell you from the lawyer's perspective that have acted for a lot of them, almost all of them got into the industry because either they or somebody close to them was helped by natural remedy, and they feel passionate about it, and they take helping people very seriously, and they have extremely highly trained people that come and train the store staff. So the store staff understands the products, understands the research, understands the quality. And if you want to elaborate on that, because when you just say, well, the vendors train us,
Yeah.
I think it has more meaning than that. And people don't understand the resource that the Canadian manufacturers are, and the outlay that it's quite an expense and all of that to be sending people around training the stores.
And it's really exciting to see the quality of trainers that they do send for us, because they are naturopathic doctors. They are the biochemists that are really, they develop the product. They know why they did it. They're looking at the niche things. They're looking at what the consumers say, we need help with this. And they look and they go and they research products so that they can find, the next best thing that's going to be helping people to sleep or for stress or whatever else is going on. And they really spend a lot of time and energy to educate us. And it's critical, because we want the science. We don't want just, oh, here's something. We want to know why, so we can share it with you.
Now, remember, so one of the things we're trying to stress on this health show is you have to protect your local health food store. If I go to Walmart, there's not going to be somebody with that training there to give me advice. If I go to a big box place, there's not going to be somebody there with that training to give me advice. And if I shop online, and if I'm lucky enough to actually get the real product as opposed to a knockoff, then I'm not going to get that advice. And if we don't support our local stores, then we're going to lose that resource. Now, I wanted to segue into something else, because as a store, if you're selling products that aren't working, then people aren't going to come back. They may not come back to your store at all, and they're definitely not going to come back and get that product. And I imagine, and you can share with me if I'm wrong, that you kind of learn, okay, what products are working, and you stop selling those that don't, maybe entire lines, and you focus on products and brands that you've come through experience to trust. Is that?
Absolutely. I mean, our team has our favorites because we all have our own health journey, and we have had the opportunity to share it with other people and get feedback saying, thank you very much. I haven't slept, in a really long time, and your recommendation helped. So for us, it's having that really impactful, meaningful relationships with a lot of these companies, and having our own personal health journeys where they work for us and they work for other people, and that allows us to share, with you. And yeah, our selection changes all the time. We're always looking for the latest, greatest that's out there, that's really able to put more the higher end products in, or get more in a capsule, so we can get closer, a little higher than allowances. I'm allowed to have this much. So a lot of the companies are really working to push those upper limits with the Health Canada, so that they can get more into capsules. But yeah, it's an exciting journey to be able to just be my own owner and just curate what we carry in the store. And we really look for stuff that works and stuff that doesn't stay.
Now, just switching to a different topic, so first of all, the people that come from the manufacturers, the representatives, you actually build a relationship with them. So when you're ordering the products, it's coming from the company, it's the most recent batches and things like that.
Yeah.
So, but there's also feedback with them, right? So they don't just train the store staff, but the store staff gives feedback. Well, I'm getting this reported, I'm getting that reported, which allows the manufacturers to change and adapt and get better. Do you want to speak about that?
Absolutely. And a lot of times at our dinner trainings, we'll have those conversations and say, well, we really need this, and this product really works phenomenal and we love it. And, can we get it in a bigger size, and all these other inputs. So they listen to us. It's a very intimate relationship. We love our reps. They come and they train us and they train our team. But also the higher ups, a lot of times will come to these dinner trainings, and we get to speak to the people that are designing. We get to speak to the people that are working with their team, and they're saying, oh, this is what we're hearing back. And anybody that's in the health industry, we all have the same struggles. So they hear it from us, and maybe in Vancouver and Ontario. And then next thing you know, next year we get products that are speaking to these things that we're looking for. So they do listen, and it's really exciting.
So another thing is so, if I go to a big box store, I don't think there's this feedback loop, and I don't think they're vetting, the products like a small store's vetting. But some people, I think, might think, oh, I'm just going to get a better price if I go to a big box store. And first of all, shame on us if we're thinking that, and shame on us if we're trying to, save $2 because we need this resource. But it's not even true, is it? Because you're part of what's called the Health First Network, which is a whole coalition of stores. So you guys buy together. You've got big store buying power, and then you also have your own brands, which are deliberately designed, the Health First brand, to be really cost effective. Can you share about that? Because some people might not understand. Well, your local health food store is part of a much bigger buying unit, so they actually do have that big store buying power.
Yeah, it's exciting. I've been, my store when I bought it was part of Health First Network, and we're 155 stores across Canada, and it's a co-op buying group, and it really gives us the buying power to be somebody big, like let's say, I don't want to say a Walmart, but we have that buying power, we have that voice with our vendors, and it really allows us to pass on those savings to our consumers through beautiful flyers, through products that we have a private label, Health First, and it's really high-end quality, and we really try to keep it priced for the everyday person so that we can make it, accessible to everybody. But it's very exciting to be part of the Health First. I love it.
Okay, and another thing, just on this value of information, is I know that people are now going online and searching this and that, and I spoke earlier about magnesium deficiency with this story of this young mom with the restless leg syndrome, and there's type of magnesium after type of magnesium after type of magnesium. And so somebody might just go to Walmart and buy a magnesium and totally get the wrong one. Can you kind of share? Let's just use magnesium as an example.
Oh, I love magnesium.
So, but just that there's different ones for different things, and that's why you need to go to a health food store where the people are trained. Because if you get the wrong one, or you don't know how much to take, it's not going to help you.
Right. So there's probably 8. Well, no, there's more than 8. So which one? And what do you want it for? You know, you want it for sleep. You got leg cramps. You want it for your brain. I have 4 shelves in my store. That's how important I think magnesium is. That's why I laugh when we pick magnesium, because it's so essential. It does over 500 things in our body. And yeah, I need to have a conversation with you so that I can make sure that you go home with the right one and not the one that's going to leave you in the bathroom all day for, you know, and you can't go to work. That's not the right one. But there is a person that needs that one, right? They need that one. And I need to make sure I give you that one, not the other one. And so it's critical that your team knows that, and my team knows that. So we'll sell you the right magnesium.
And I also want to talk about kind of the relationship you develop with the people that come to your store. You know, in my opening this morning, I shared a story about Dr. Charles Popper, who's a psychiatrist at Harvard University, who started using Empower Plus to treat serious bipolar disorder. And I remember at the trial, he said, you know, it's a curious thing, like somebody might be on 10 capsules and no difference at all, but at 11 capsules, bang, fully healed. And I know it's the same with a lot of supplements. So if the person isn't coming back to the store, or they're coming back to the store and saying, oh, you know, well, how are you doing? I'm not really any difference. You guys are able to give them dosaging advice and other suggestions.
Well, not
so
under the new regulations, no.
No,
But
well, that's
in the
right.
back
I
in
mean,
the day,
when you move your store to the United States or other countries, you're able. No, but but in all seriousness, you get to know your customers over time, like,
absolutely.
and so you know you've marched them through where they're sharing parts of their health journey, and that probably helps you then, you know, when something new comes up. Oh, okay, you know, this and that is. So tell about kind of the relationships that you develop.
Yeah, it's really good, because being a brick and mortar, you buy something, you have a question, maybe you just didn't quite get all the information, or you can come back and say, hey, Kim, you know, I didn't quite, you know, my legs are still giving me grief. We can say, hey, what was the dose? You know, do you need a little bit more? Because I am uniquely me, right, hun? And you're uniquely you. And what the amount of magnesium that I may need compared to you is completely different. And so we're able to help you to navigate those parameters and make sure that you're taking something correctly, or maybe at the right time of day, or, you know, move your dose up a little bit to find what is your magic number for whatever it is that, you know, we're trying to help. So that can't happen if you buy it online. That can't happen at Walmart, but it can happen when you know, I see so many familiar faces here, like when you know people and you feel that you can trust us and come and ask us these questions, because we love to share, and sometimes we talk too much, but it's okay. You know, we want you to be happy and get results.
So don't go to Health Matters if you're in a hurry.
We can do fast checkout for sure. You just let us know. You're on a time crunch, man. We'll get you in, we'll get you out. But, you know, you're always free to come browse.
Yeah, and I also know that your store, you really built a community.
Yes.
And, you know, you're really involved with the community. I hope that everyone's coming to appreciate. We could go on and on and on, but I'm just trying to touch on the major points. Our local health food stores are a tremendous resource. And if you're not using that resource, you need to start using that resource. You need to find a team that, you know, you feel a community with, and plug in. And so you're going to serve them by giving the feedback, which then goes up the line. You're going to enjoy the community, but you're going to get products that, listen, a little, you know, a smaller store, I'm not saying you know what I mean? You're not Walmart.
Yeah.
They're not going to stay in business if they're carrying lines that aren't effective. Because some lines are more effective. Some manufacturers, it's better quality. Walmart and Costco, they don't care. They're just high volume and price. But a smaller store, they're going to have the lines where the customers are buying it again and reporting good results, or you don't survive. So you're just on economic laws alone going to be getting more effective and better products. And I know it's just the reality, but you're also going to get that community, and you're going to get that advice. And like I say, you know, even just one pill can make a difference.
Yeah.
Right? So yeah, so Kim, and also I just feedback from the audience. Isn't it clear she loves people and wants to help? You know.
Yay!
But that's what it's all about, right? It's about loving each other, like loving others like ourselves. And you're going to find that in health food stores, because almost everyone there is there either because they've been helped and they're now passionate about it, or they've just got that healer personality. Like,
Yeah.
you're going to see it. So, Kim, it's just been a pleasure.
Thank you.
Just
Yeah.
a pleasure to have you.
Thank you. And you know, being part of the Health First Network, that was one thing I really found, is that being with all these other health food store owners, we're all the same. We're crazy, we're passionate, we go above and beyond, we love to share. You go to any of our events and all we do is talk. You can't even hear, the din is so high. So it's a passionate industry, and you know, we only get sometimes to see you a little bit, but hopefully you know, we can make an impact in everybody's life, you know, positively, whether you know, do it through nutrition or just, you know, doing supplements. So I just wanted to say thank you guys for all coming today to the store. We had an event, so thank you everybody that was there. And also thank you everybody that came to, this is our third event this year, well, since last year. We've had 3 events with Shawn because we're passionate. We've had 2 barbecues and this event, and we really care. It's a lot of fun, but we want to get the message out.
Yeah, no, it's just been a pleasure. Absolute pleasure. So Kim, thank you for coming and sharing with us. Thank you for your passion for helping people. So I'd like to have Dawn Chris come up. Dawn, do you want to come and join me up here on the stage? Dawn, welcome to the World's Greatest Health Show.
Thanks for having me.
And Dawn, you're here to share your health journey.
Yeah, I've had a little bit of a personal journey, and it's been a bit of a rough last 11 years.
Yeah, now, can you hear her? Is her mic close enough? So you got to just hold it closer to your mouth. So can you share with us your journey?
So back in 2014, I got really sick. We came home from a vacation in Hawaii, lovely time. And 2 weeks afterwards, I started getting really upset stomach. And, you know, and I thought, geez, you know, you hear all these things about don't drink the water in Mexico and don't drink the water in, you know, wherever else. And I thought, well, I didn't do that. And I didn't really have any bad food. I didn't eat out anywhere I wasn't supposed to. And so, you know, I started out with, okay, well, maybe I did get a bug. Maybe I got a parasite, something like that. But I continued to get worse. And I had gone to see couldn't get in to see my regular GP. So I ended up going to a walk-in clinic at the hospital. And the first thing the admitting nurse said to me was how far along I was. She thought I was pregnant.
So I'm just going to slow you down here.
Sure.
So how long is this going on before you go to the hospital?
It was probably going on for about a month, about 4 weeks. I tried to get it under control myself, tried to, you know, figure out what it was, and just wasn't having any luck. And so finally thought maybe I better go in.
So when you go into the hospital, because you're a fairly small person,
yeah,
your stomach is distended so much that they thought you were 9 months pregnant.
Yeah.
Okay, now that, aside from the embarrassment, that had to be uncomfortable.
It was very uncomfortable. So I was in and out of the bathroom every 20 minutes. You know, I had to plan my days around like my errand running, my work, everything. I had to plan it around washrooms. If there was a washroom close enough, you know, did it have a lock? Did you need a key? Did you have to go back to a cashier and get a key, or could you just go in? It was panic. It makes you have anxiety. You know, I mean, these are issues that you don't want to admit when you're going out into public. And so they sent me through. There's a protocol. You got to start with an ultrasound. Then you have to go for a barium enema. Then you need to go for a CT scan. Then you go for an MRI. Then finally, you might get a colonoscopy after 6 months to a year. And I was in such bad shape that, you know, I had phoned the doctor's office and I had said, you guys got to get me on a wait list. You got to put me on a cancellation list or something, because I'm not going to make it. Like with how I was feeling and the amount of blood I was losing, they didn't have a diagnosis. They didn't have me on any drugs to slow this down or to help me out. I thought I was doing everything right. I was a healthcare aide at the time. So I thought I was doing my due diligence and that I was taking all the steps I needed to take, but yet I wasn't getting the help I needed.
And just, just so everyone understands, I mean, you're talking about blood. There's blood in your stool.
Yeah.
And you basically can't keep anything down. It just goes right through you.
Yes. So
And-
every time I would eat, it would, within 20 minutes, it was gone. So I was absorbing no nutrients from my food at all.
And so I imagine you have no energy and
Correct.
your mood sucks. Were you restricted? Like obviously you had to be near a bathroom, but was your daily activities restricted otherwise?
Oh, they definitely were restricted. And, even my husband, I mean, we didn't do anything socially for at least 3-4 years after that, like after the diagnosis, which came obviously a little later that same year in 2014.
So, that's huge. So it was so onerous to be going out because you'd be like say if you wanted to go to a nice dinner.
No, not a chance.
You can't be sitting there for the hour ordering your food, eating it, appetizers.
I would be lucky if I made it into town, the drive to go into town.
Right. Okay. You see, and that's it being disabled.
Absolutely.
Okay. And I couldn't imagine not getting your nutrients, like just things going through. So what happens then? You go to emergency or the walk-in clinic because you can't get in to see a doctor.
Yeah, so that was the start of it. Had gone to the walk-in clinic. They had sent me for a basic x-ray that day, and that was it, just an x-ray. Well, of course, the x-ray didn't show anything. So I persisted and I kept on going back and kept on going back, but there is a protocol. So you can't they don't just take your word for it or see what's going on and then send you for a colonoscopy. That doesn't happen. You have to go through all their different systems first before you finally get what you need. So I was doing that. Now, I never made it to the appointment. So it was like I said, when I had called the doctor's office, I said, I'm not going to make it. They had made me an appointment. This started in March, and my appointment for the scope was in August. And by the end of April, I was probably losing about a cup of blood a day. And it was not replenishing itself. So when we, the appointment was set for the middle of August, and I made it to the first week of August. And the one night I was laying in bed, and every time when you're really, really tired and you fall asleep, and sometimes your body jerks awake like that, that's actually your heart stopping. And it's your brain telling your heart to start again. It's like a tripwire for your brain, for your heart. And that was happening to me about every 4 minutes. And my husband was awake. He was reading his book beside me. And so it was happening about every 4 minutes. And finally he said, you know what, I'm taking you in. He says, I don't think you're going to be alive in the morning if we don't go in. And so we went in, and that was a whole other story. So it was three or 4 days in and out of the hospital that week till they finally got me in for my colonoscopy. Took me into the Misericordia Hospital. And when I came out of they used anesthesia for the scope, so I was very, very thankful for that. I was in a lot of pain, a lot of agony, didn't have a lot left to me at the time. And when I came out of the anesthetic, the doctor and the nurse were standing over top of me, and she said, I haven't seen a patient this bad in my whole career. And she didn't know how I had lasted that long. And I didn't even know what to say. I mean, I'm laying there just coming out of the anesthetic, and I'm thinking, well, geez, maybe you could have got me in for a scope sooner. Maybe you could have assessed me a little bit better to what my condition was at the time, and maybe moved me up a little bit higher on the list, because now I'm living with residual issues from that.
Right. And so eventually they diagnosed you with something. You later on will say, I don't think that was it at all. But they diagnosed you with something and then put you on a protocol. Do you want to share with us kind of what that was?
Yeah, absolutely. So they ended up diagnosing me with ulcerative colitis, severe. While I was in the hospital, I was admitted. I was in there for 2 weeks. They gave me 2 options. They gave me an option of going on this drug that had no long-term data, which was an infusion. I would have to go in every couple of weeks. It was going to cost $10,000 every 2 weeks to go in and have this drug infused into my system. And when I asked how long I have to be on it, they said forever. So the other option was they wanted to do surgery and they wanted to take my large colon. They wanted to take my large intestine. And I basically said to her, with some of my last words that day, I said to her, you better sharpen your pencil because I'm not doing either one of those two things. And, you know, to this day, I don't know how many times over the last 11 years I have gone in and they have said to me, you need surgery now. And I have refused because I have said, no, you have not done your job and you have not helped me cure what I have wrong. You've only masked the symptoms and gaslighted me the whole time.
Can I just share something? Teresa, Dr. Rachel's name from Kamloops, Maurice. So we had a Kamloops. One of the speakers was Dr. Rachel Maurice, who was an anesthetist. So it was 10 years of training, and then she practiced 20 years as an anesthetist. And one of the things that came out clear in her presentation was she would do anything on earth to avoid a surgery, because anesthetists, that's what they do. They put you to sleep and watch the surgeries, because she just says there's so many complications. Like, she doesn't trust the surgeons. She doesn't trust the process. It came out so clearly.
Wow.
So I think your intuition was.
Well, and funny that you actually, you bring her up as well. So I used to manage a private surgical facility here in Edmonton. And so I worked with a lot of anesthesiologists, and there was one in particular, and he's close to my heart. He's a very wonderful man. And, he came to see me every day in the hospital because he thought I was going to die. And he wanted to make sure that I had support. And, I'm very thankful that I had that. So they did put me on a protocol. They put me on a high dose prednisone. So when I was in the hospital, they had that going into me, and I had both arms full of IVs. I had 4 poles hanging beside my bed. And within the first week, I started losing my hair from the prednisone. So prednisone, it can be, I think pharmaceuticals have their place, but I think they have to be few and far between, because I think there's a lot of better answers than that. But they did put me on the prednisone. They put me on another one called mesalazine, which is a maintenance drug for ulcerative colitis. And I was on the mesalazine for a very, very long time, till I started, when I would go to see my regular doctor, my blood levels for my iron and my liver enzymes were not good, but yet nobody was saying anything to me. So good thing I was watching on my own, because I knew that I was getting damage from those pills.
Right. And you were on them for 4 years, I think.
4 years, yeah, 4 years in the beginning, but then longer after that again.
Okay, now your health journey doesn't end there.
It doesn't.
So do you want to carry on?
You bet. So, in 2018, I had this very strange thing happen. And, I had to, it's a bit of an embarrassment, because you do something for yourself in your life and you think it's the right thing for you. And then it turns out that it wasn't the right thing. So in 2008, I decided that I wanted breast implants. And, it wasn't anybody else's decision. It was a decision for myself. I was always a very, very tiny person, no chest at all. I wanted to feel feminine. I wanted to feel that femininity. And so I made that choice, and I got them in 2008. I thought that I had done all my due diligence. I was still a healthcare aide at that time. I had done research online. I had spoken to my surgeons. I had spoken to others who had gotten it done. I wanted very particular ones. I didn't, I was just looking for a little bit of lift. I didn't want anything outrageous. So anyways, fast forward the story in 2018. So now we're 10 years later from the implant time. I wake up in the morning and I've got one breast that's over twice the size of the other one. So I decide to go in, and I get an ultrasound done, and the radiologist comes out and he says, I don't want to alarm you, but I was just reading something this morning by chance. He says, I think you might have this man-made cancer from your breast implants. And, I'm not an alarmist, so I just I looked at him and I said, okay. I said, give me the lowdown. what do we need to do? He says, well, I don't know. It's really new. He said, it's rare. We haven't heard of it before. He says, we've just been getting these emails lately. He said, so we've got to do more research. So I was the first one that was diagnosed with something called BIA-ALCL. And from here in Edmonton, they diagnosed me here. And what that stands for is breast implant associated anaplastic large cell lymphoma. So it is a T-cell lymphoma. And if anybody knows anything about lymphoma is a blood cancer. So it's a lot harder to treat as well. You know, it comes in that rare category, right? Now, a lot of us advocates, because after I was diagnosed with that, we decided, I joined an advocacy team. You know, we wanted to do the research. We wanted to know what was going on with other breast implants, and we wanted these ones taken off the market. I had met women now, you know, who had the same thing I had, and why? Why did we have that? Like, these were supposed to be safe and approved. They were approved by Health Canada. The data should have been there, but it wasn't.
I want you to elaborate on that, because you actually went and met with Health Canada.
We did.
You looked into how they go about this.
Yep.
And you can share kind of your thoughts on whether they can be trusted to approve things like this.
For sure. So, you know, when I heard that Shawn was doing this tour, I thought it would be a really great opportunity, because I don't think people understand a lot. Well, we didn't understand. None of us girls understood. The ones that got the breast implants, we didn't understand how Health Canada works when they approve things. So there was 3 of us who went to Ottawa in March of 2019, and then 3 of us that we had on virtual as well. And, you know, we had about, I want to say there was about 30 people in the room that we were discussing things with. We got to meet with the medical device team. So we learned how they approve devices and drugs, because it's kind of the same process. They're part and parcel. And what it is, you know, a manufacturer will go to Health Canada and they will say, you know, we have this new product. We've done this many years of research so far. So let's say they've got 3 years of data. You know, we want to bring this product on the market. So Health Canada looks at it and they say, okay, let us, you know, tell us about your product. What does it all do? You know, how is it going to help people? How is it better than the other ones we already have on the market? Yada, yada. Well, they can approve, Health Canada can approve that product for market with conditions. And you might not know about that at all. It could be a hip replacement, it could be a knee replacement, it could be anything. It doesn't have to be a breast implant. And it could be on the market, and it might only have a couple years of data, but if you don't go to Health Canada's website, you will not find that data. You have to be very specific, put it into their system, and then find what comes out of that. But the thing is that they're already being lax with their medical devices and their drugs. Because what I found out is that, so my type of breast implant was Allergan. At the time, Allergan had made the ones that I had. Allergan, after don't quote me on any of this because I don't quite have the years down pat, but Allergan was bought out by another company. And so their research and development department got shut down. So even though they were given conditional approval to have their implants in Canada, they never finished their research and development and came back to Health Canada with their data. So now picture me going in there 10 years later, after having these implants in for 10 years, and I have cancer. Now they will sit there and they will say, you have BIA-ALCL. No, I have cancer. It is the C word. It's no different than any other. But yet we were treated different. We were treated as though it was all in our mind. So when we told our stories to the medical device team, they were very shocked. Because see, they provide information to the plastic surgeons. So they provide medical device data in a user manual, but that information is given to the physician. It's given to your plastic surgeon. It's not given to the patient, but that's where all the data is. So that's where it said all of the side effects. My implants had over 10 pages. I didn't know that. And
it
they
would have been
didn't get the
helpful for you
information.
to know.
Exactly. And now, now here I am coming in 10 years later and I'm saying, where's the data? You guys are supposed to have oversight over these devices. You've approved them. You've given them a condition. Let's just say 10 years. So after 10 years, that company was supposed to come back to them with long-term data to say, this is how many patients are improved. This is how many patients are happy. This is how many patients have breast implant illness. This is how many patients now have cancer. They didn't have any data. So the only good thing that came from that is that we were able to get the implants off the market by June of 2019. So after we dealt with Ottawa and we spoke with them, 2 days later, they also had implant hearings at the FDA. So we also went with hundreds of other women that came globally from every country of this world. And they gave testimony to the FDA of the harm and the gaslighting that we've experienced.
Can you share with us, I mean, because the gaslighting's real, can you kind of share with us about that? Because you'd also kind of alluded to, you weren't being taken seriously.
No.
And
no.
I think it's important to understand what that experience was like.
So, and I mean, it's kind of difficult actually because it's still happening today. So I actually stepped away from the advocacy because it was too much for me. In order to heal, I needed to step away. And, I was probably, aside from my full-time job, my part-time job, my family and my acreage, I was probably putting in an extra 40 hours a week, just helping other patients get the care that they deserved. We were included, us as patients were included in many conferences that the plastic surgeons were putting on over the last, I'll say 5 years. And so we've been able to converse with them, to really give our serious concerns and our thoughts and our data, right? Follow us. We are the ones who had the cancer. Follow us, But we were told that we needed to see a psychiatrist. We were told that plastic surgery patients needed to have like a follow through, we should be having mental help as well. That a lot of the issues were in our head. I don't understand how you cannot take a patient seriously, and I don't understand how you can because the pharmaceutical companies, it's no different than with vaccines. Vaccines they're a protected thing, right? The pharmaceutical companies are protected. It's the same thing with breast implants. Breast implants are also protected. We are unable to sue.
Right, and that's what she meant by protective, is you can't sue for injury. And so you were in the same place. So in Canada, you are not allowed to sue because a breast implant caused cancer.
Yeah. So there is, I think they are still trying. They are still trying to do some lawsuits. I will not get involved in that. I feel that I am moving forward as long as I can, help one more person get well or remove their implants so that they don't have the same thing happen. Because what the journey ended up being is that the implants is what caused the colitis. So they are part and parcel. They were what was my ticking time bomb that was it was putting me into an autoimmune state. So I ended up with, I want to say, I think they diagnosed me with about 8 or 9 different autoimmune diseases. My personal belief is to wake up every morning and say, I don't have them, because I don't believe in it. I believe that now moving forward, that my supplements and what I take to protect myself and to keep my immune system healthy is what is most important.
And I'm wondering if you can share that part of your journey. So, but just to kind of fill in the blanks. So yeah. You end up having surgery, but even with the implants removed, you're facing, you've developed autoimmune issues, you've got the hair loss. Can you kind of share with us about that and then how you've come to become healthy again?
Sure. So, it's a long journey, and a lot of naturopaths will tell you that sometimes, as long as you're as long as you have been sick, it might take you twice as long to get well. Now, we don't want to think of that because that's a longer journey than we want to have. But the good news is that every little step is actually healing you. It is curing you. It is not just masking the problem. It's actually healing what's inside of you. So I did have surgery. I had to have 2 surgeries done. I had all my implants and extra tissue removed for margins just in case. Since then, it's been a little bit of a journey because you need to treat the whole body. So my clinicians that I was seeing at the time, sure, you have one that's treating my colitis and one that's following me for my breast issues. But that's not enough because everything has been affected. Everything in your body's been affected, including your mind. Because to go through something like that, to be at death's door, and what I mean by that is I was so sick by the time I ended up in the hospital with the colitis that yes, they didn't know if I was going to make it or not. I wasn't there because I have a lot of faith. And so I was just going through the motions. So I knew I was going to be okay. But I guess everybody else didn't think that. So I was worse than I thought. Now, yeah, so after the surgery, I started taking my supplements again. But it was extra. It wasn't just for my intestines to heal my intestines. It was to heal everything else that had been damaged by the drugs I had to take prior to that. So the healing of my liver, the healing of my kidneys, the healing of my lungs, the healing of my joints. They had diagnosed me with connective tissue disease. Well, I want to be able to run after my grandkids, I don't want to have that. So now that I have been treating everything naturally with natural medicines, no more maintenance drugs, no more gaslighting my body, telling it it's okay when it's not, no more tricking my mind into telling my body that it's okay when it's not. I'm healing and I'm curing. And I guess the best proof that I can say is I'm here. And I wouldn't have been able to be sitting here for more than 20 minutes 5 years ago. So I think that's a big accomplishment, and that chalks up to natural medicine. And so what it's also, it's also really led me into not just the supplements and being able to, to support, places like Health Matters, but I'm also foraging in my own yard and finding things that help me personally. I'm finding plantain in my yard. I'm finding, all kinds of things in my yard. But things also I can grow. I can grow my own slippery elm. I can grow my own, St. John's wort. I can do these things in my own home garden, right? And I know where it's coming from, and I know it's not going to harm me. I know it's going to help me, and it's not going to harm me. And I think that's the biggest thing. I think Health Canada needs to stay in their own lane. They already do not have enough oversight over what they take care of now. They can't follow their medical devices. They can't follow their drugs. They don't know which ones, who's even supplied their research and data for the ones they currently have. We don't even have a registry, we don't even have a breast implant registry where we could contact our patients and say, hey, if you have these implants, you have a high chance of getting cancer. We don't have a registry for that. We have advocates who were in the House of Commons last year and the year before begging for this. We need a champion. So if there's anybody out there, any nonprofit who would like to help take this on with us, by all means, please contact me and I will put you in contact with the right people. But Health Canada has enough on their plate. I think they need to leave us and our natural medicine alone.
So you kind of preempted. I usually, end an interview saying, hey, what's your message to Ottawa? And you anticipated. But it is interesting, isn't it? So you've been suffering all this time, and even after the surgery, you were still suffering because basically your body's been ravaged. But
yeah, because you can't just treat the one thing. it's your whole body. Your whole body works together. It's not just one thing at a time.
Yeah. And and now you're doing well.
I'm doing very well right now. I will say, just, do I have time to say a little other? Okay. So, I had an issue here in March where I had some really bad upper GI pain. It was so painful, I thought I was having a gallbladder attack. That's how painful it was. I bent over, sideways, had a bath, did everything I could possibly think of, couldn't get rid of this pain. Finally, it was so bad I was almost passing out. My husband took me into the hospital. It ended up being, and I'm going to say this lightly because there isn't really any blame to put anywhere. But instead of listening to me, listening to my symptoms, they looked at my chart and said, oh, this woman has severe colitis. Let's treat her for that. So even though my pain was not where it should have been for colitis, they decided, hey, let's just treat her for that. So I spent a week in the hospital. We don't have first world healthcare. I'm going to say that right now. We don't have first world healthcare. The week that I was in there, I had 5 more instructors with students with them because it's surgical. It was surgical practicum in March. 5 instructors with their residents came to me, encouraging me again to have surgery to remove my colon, and said that I would never, ever heal or be healthy enough to live a normal life. To me, that's the worst gaslighting of all. So I spent that week there. Again, they put me on high-dose prednisone. They put me on other drugs. When I got home, I was in such bad shape. I had lost 17 pounds in a week in the hospital because they don't have the proper food to feed somebody, even if that person does have ulcerative colitis. So once I got home, I went off of their drugs again, and I went back onto my natural medicine, and this is where I am today. And I have no more bleeding. I have no more running to the bathroom. I still have a little bit of gut anxiety, those butterflies you feel when you're just getting ready to talk to Shawn, right? And but otherwise I'm doing good, and I can function, and I take care of my granddaughter on a regular basis now, and for that I feel blessed and very, very fortunate.
Okay, well, Dawn, it's just been an honor.
Thank you.
I think everyone.
Thank you for having me.
No, but I think everyone's appreciated. Like, you've had a tough health journey, but then you became an advocate, and you stood up to make a difference. And especially when you're not healthy.
I didn't feel like I had a choice.
Okay, share that, because this is, I think this is going to help people. So when you say you felt you didn't have a choice, share what's going on inside.
Well,
Excuse the pause for a second. Stand by.
Gold continues to surge to new highs as stocks fall. The threat of a global trade war is here, and you need to protect your savings. Stop trying to time the market and start buying today. Nuggetstacker.com.
I guess my nature is to help others. That's always been my goal. I've always been a caregiver, right? I used to work in long-term care with the older residents and taking care of them, and some young residents too. And it's heartbreaking when you're working with a younger resident who's maybe in their 30s and their family comes daily to visit them, but they're in the hospital in long-term care because they've got Lou Gehrig's. You've got patients who are begging you to put the pillow over their face. This is, I come from a very compassionate place, a very empathetic place. I actually quit working at the hospital because I couldn't do it anymore, because I couldn't stand how residents were treated and how they were not given the opportunities to continue their life with dignity. And that really, really bothered me. So that's where I come from. So when something happens to me, if there's a way that I can help others to not suffer through that same thing, then I'm going to do it. So I felt I didn't have a choice. And I wasn't just going to do it locally. I was going to go to the top because that's where we needed to be. And you know, just a side note, we did have, and we do still have, kind of a relationship, like our advocacy group has a relationship with Health Canada. You know, we talk with their medical device team, well, the rest of the advocacy team does, where we even helped give them data for their website, you know? And to me, it's like, well, why are we the ones doing that though? Why is it the advocates? Sure, we have the answers, but we had to research that. You guys have got all these companies and all these businesses and all these scientists at your fingertips. Why is it us? But we're still more than willing though. And that's the thing. If it's going to help get out the correct information and it's going to help somebody else, then that's what we're going to do.
I think that's inspiring, isn't it? Dawn, it's been a pleasure.
Thank you very
And
much.
I think I speak for everyone, and you spoke about butterflies. It's not easy to get up in front of people and share a story, and basically, personal things.
For
But
sure.
I think I speak for everyone that you've really inspired us today. So
Well,
thank
thank you very much.
Dr. Lana Nichols, can you come up, please? Welcome to the world's greatest health show.
Thank you.
So, how many people here know Dr. Lana? Oh, okay. So, can you share with us what you do,
Sure.
and then what the heck brought you that? But first of all, let's talk about being in the sports halls plural of fame.
Oh, little known fact. I was quite a nerd when I was growing up, but everyone thought of me as a jock for sure. I played in lots of different sports, but excelled in volleyball when I was younger. Played provincial volleyball, then went on to play university volleyball. Met my now husband when I was 16 playing provincial volleyball, which is awesome. And then played at MacEwan for a number of years and was really blessed. I actually got inducted into the Alberta Hall of Fame in 2015 and then the Canadian Hall of Fame in 2017, I believe. So yeah, it's kind of fun. My kids think I'm kind of cool.
You're the only one in the room
Right,
that can
100%.
say that. Sorry, I couldn't resist.
No, totally do it. Bring it.
So tell us what you do.
Yeah, so by trade, I'm actually a doctor of chiropractic. I went to school in California in 2000 after I was done volleyball and coached 1 year at MacEwan as the head coach there, but gave it up so I could become a chiropractor because it totally changed my life. Practiced down there for about 12 years in wine country.
You're going too fast. Okay, so it practically changed my life.
Yes, it
that
sure
in
did.
itself is a story. So
Yep.
can you, in a slower way,
Sure.
tell us, how it changed your life? So what was going on?
Yep.
What was the journey before you found that chiropractic solution?
Yeah, so I suffered from very, very severe migraines from a very young age as a teenage girl. And they would affect me like 2-3 days where I'd have to just like lay in a room. I'd puke, I couldn't handle lights. I remember crawling one time to get to the office in junior high school to call my mom to come get me because I couldn't function, right? So I missed school, obviously. I missed sports. I missed out on social things. And then the pain was excruciating. And if you haven't ever experienced a migraine, it's very hard to wrap your mind around how intense they are. But yeah, I suffered very significantly from those. And I had a cousin who was a chiropractor, and I happened to go down on a trip. He was practicing in California, and he offered to give me my first adjustment. And I said, sure.
But before we get there,
Yeah, okay.
So how many years are you suffering with these migraines?
It had been probably about 8 years.
Okay, so 8 years.
Yep.
And like, is it almost weekly where you're
Yeah, I was having them at least once every 2 weeks, if not weekly.
Okay.
Yeah, and they were
it's-
intensifying as well.
And so every time it happened, like you're out for like 3 or 4 days.
Yeah, could be. Yep. So it was
Okay.
significantly impacting school and sports for me, for sure.
Right. Okay. And what are the medical doctors doing to solve this?
Trying to remember back. I had pretty crunchy parents, so I literally had to be like dying in order to go to the hospital, which ended up serving me fairly well as I grew up. But yeah, I did go to the doctor. I remember this. Their initial thing was to want to put me on birth control pills. So they thought that it was hormonal in nature and that my body was going through the different puberty changes. So that's what they thought it would help to regulate my hormones and that would in fact change my migraines. My parents were not impressed with that answer. Yeah. But they became so severe that I actually did try that for a period of time. It didn't make a big change for me. So I just basically suffered with them. So.
Okay. So after 8 years of suffering,
Yep.
you were down in California visiting.
Yep.
And you have a cousin that is a chiropractic doctor who says, hey, I'll do an adjustment.
Yeah.
Okay, so what happens?
Yeah, so a little bit nervous because I'd obviously never been adjusted before, but it was my cousin and I trusted him. He's a 6'4" big dude with like massive hands. It was like crazy. Anyways, he adjusted me and I literally experienced, this might sound really woo-woo, but like a flash of light, like someone like turned the light on in my head. And I remember just kind of laying there. He's like, yeah, why don't you just sort of hang out there for a little bit? I'm like, yeah. So I just laid there and then, got up and just felt different, felt lighter, felt like a connection between my brain and the rest of my body. It was pretty wild. And then he said, hey, you got a lot of stuff going on in your neck. It was probably from all my jumping on the trampoline days and quadding and motorcycle riding in my acreage growing up. But he's like, you should get under care when you get back to Edmonton. And I was like, okay, I'm going to trust him. And he said, yeah, your neck needs a lot of work. So that's what I did when I returned home. I sought out a chiropractor and I started getting under some regular care. And little by little, it started to shift. And then all of a sudden, it like really shifted for me. And that was when I was 19. And I haven't had a headache, let alone a migraine, since then, since I was 19. Yeah.
I'm not going to ask you how old you are.
I'm turning 50 in 3 weeks.
Wow. Okay. So you had gone then, so 8 years, every other week, but more likely weekly, 3 or 4 days where you're out, like basically suffering horribly. Like, I mean, you had made a point of saying if you haven't had a migraine, you really can't appreciate what it's like. So really, these chiropractic treatments freed you.
Absolutely. It gave me my life back. I got to not miss out on sports and friends and family and just the freedom of the pain. Like pain it wrecks people. It sucks the life out of you and it's draining and you would do anything to help it go away or to stop it. So yeah, it was life-changing for me for sure. So
it's interesting. We interviewed for the health show, and just so you know, we interviewed Dr. Lana for the health show. So there's quite a neat interview there. But we also interviewed Dr. Cooper, who's Dan Cooper, who's a chiropractor who also, like, he was a diver, like very athletic, and then got vertigo, and it couldn't be solved, and then bang, solved by chiropractic, and it's like, okay, and now he's a chiropractor, and you're suffering, you're cured by chiropractic, and now you're a chiropractor. Tell us about that, because I think people are already getting the idea she's very passionate about healing people. So tell us that journey, because it's a big commitment.
Oh, definitely. You had to finish, obviously, undergraduate degree here, went from Grant MacEwan to U of A and had to do all the pre-med parts. And then had to get a visa to go to the United States and go to school. I could have done it in Canada, but I wasn't super impressed with the holistic nature of the school out east, so I chose otherwise. But yeah, moved to California, which going from a very small rural, grew up on an acreage, to San Francisco, it was like shock of my life. So many people. But yeah, and then 4 years of schooling and then an internship as well. And then I also committed myself to doing a lot of mission work in third world countries. So I did 7 trips. I did to El Salvador, Nicaragua, Brazil, just serving people. And so yeah, it was a big commitment. And then I chose to practice in California for a few years. I was there for 12 years in private practice. Yeah.
So you're describing education, and I have to say, one of the things this health show's helped me, like the beauty about this is I get to interview people, and you know, and we pre-interview and all of this, and so I'm learning things. I didn't appreciate just how much training is needed, and like it's like our medical doctors on a pedestal, like we worship them.
Yeah.
And I find on average they have less training than our natural practitioners. So you had to do basically a Bachelor of Science.
Yep.
And then pre-med classes, like you guys learn all the anatomy, physiology, all of that stuff.
Yep.
And then 4 years of chiropractic.
Yep.
So, you know, what I found is that with all of these traditionalists trying to, you know, the traditional Chinese, and I say doctors, they're not allowed to say doctor, but I say they're doctors, and naturopathic doctors and homeopaths, they get more training than the medical doctors, and same with chiropractors.
Yep, absolutely. I mean, we take a lot of slack, actually, for sure, as chiropractors. You know, people tell us we're not educated often. It's incredible. My favorite is like, I like your white coat. It's not a halo, though. So yeah, it's unbelievable how many times I had people attack my education. But we take basically the same schooling, but as a medical doctor. And then we also take far more anatomy, physiology. I did 2 years of gross anatomy. I did dissect human bodies. Then we also then do a ton of nutrition and physio and all of the natural care stuff that's where they're going to study drugs and surgery, right? So that's the off branching. But yeah, we have an unbelievable education, and very, very proud of that. But yeah, we take a lot of slack. It's pretty interesting. Get called a quack and a cracker and all the things, right? Like it's awesome. I just laugh because bring it on.
So can I share, like everyone loves lawyers. So I don't, I've never had, but I have to share with you, just because it's kind of the same thing, right? Is what I found just absolutely amazing when I became a lawyer is, you know, at a social event, and this is how it happens, and in this order is you'll hear a couple of lawyer jokes, so now you're offended, and then they ask you for free legal advice. And I can tell you, I always thought you should reverse that. You should ask me for free legal advice before you offend me. So
so true.
yeah.
Oh, yeah. I
Okay.
always get the my back as soon as they hear I'm a chiropractor.
What is the practice of chiropractic medicine? Because there may be some people watching that really have never been to a chiropractor. They don't know what the practice of chiropractic medicine is.
Mm-hmm. And I think that's a wide range, actually, to be honest, because I think the perception is, you know, you go to a chiropractor when you're in pain, okay? And the people think that you have a bone that's pressing on a nerve and it's causing pain. And I get that part. There is physical things. People actually do have what's called a subluxation, okay? So it's less than a dislocation. It's a misalignment that places pressure on your nervous system. So there's a big part of that. When I saw that switch of light, I swear that's exactly what happened, is like something got relocated. It wasn't dislocated, but shifted in my neck. And it literally connected my brain and my nerve system. I was trained very much like more holistically, even in the chiropractic realm. Immediately I was very drawn to caring for babies and pregnant moms and kids. I even took animal chiropractic, which I didn't pursue it entirely. I would have had to do even veterinarian stuff, like that's a whole other part. But if you look at the word subluxation, sub means less, lux means light, and ation is expression. And so when I connected those dots and had an unbelievable mentor who taught me that chiropractic was about connecting man the physical with man the spiritual and turning on your life and your light force, and you're serving up life every time you make an adjustment with love. It rocked my world. So that's how I see chiropractic.
Now, I also wanted to talk because you do live blood analysis.
I do.
And some people might have no idea what that is, and what you see. And so, can you share with us about live blood analysis?
Yeah, so I moved back from California about 10 years ago, and at that time found out I was pregnant, so decided that I was going to be a mom for a while and not actually actively go back into chiropractic practice, which would have meant doing a few more steps in Alberta. I had done my written parts of my boards for chiropractic and what have you, but I decided to just put that on pause, which ended up being a really amazing blessing because I didn't have a college with a noose around my neck. And then COVID happened. So I didn't have technically a chiropractic license in Alberta, right? Because I didn't do my jurisprudence and what have you. You can't take away my chiropractic experience, my license, any of that stuff, right? But I was able to speak very freely because I had zero fear. What are you going to do to me? They called me once. It was an awesome conversation. I enjoyed every last minute of it, let me tell you. But
I have a feeling they didn't enjoy it with the
I
same
bet they did not.
joy de vivre.
No, they did not. But yeah, I got to educate them and just say, what are you going to do to me? I'm not licensed by you guys. You really don't even have a right to be calling me right now. So I'll say whatever I'd like.
And just back to the live blood cell analysis,
Yep.
You're still going to explain
I'm
what it is, but
coming
I'm
there,
curious how you even came across it.
Yeah, so I had a very dear friend that I'd actually known since I was 17 when I worked at McEwen and played volleyball at McEwen. And we reconnected. She's very dear to me, Lisa Patet. And she said, hey, I have this friend who works in Ontario and she does live blood analysis. And I didn't honestly myself really know. I'd heard of it. I didn't know a lot about it. And she said, hey, like when you were doing your undergrad, didn't you work with like microscopes and you're all nerdy and sciencey? And it would be so cool because you'd be able to incorporate all the knowledge you learned as a chiropractor. And then also all my nutrition background. I also got my personal training certification, and then all the specialty I did with babies and kids. And she's like, you could bring it all together and do this whole looking at people's blood thing. It would be so cool. You should check it out. So I was like, huh, okay. So I did. I started looking into it. I reached out to her friend and mentor and hummed and hawed about it for obviously a while. And then during COVID, with all of the injection stuff and the concerns about, all the different effects of what was going in people's bloodstream, which I had already studied very deeply, childhood injections. So I was very clear on that in the first place. But I was like, you know what? People are going to need big help. And I'm not sure I want to be a part of a college who thinks they can call me and threaten me. So I did the schooling and I got to fast track it because of my background. And yeah, it was incredible. And learning all about looking at people's blood, which is your river of life, and looking at your cells, which are your smallest unit of life. I knew how to read blood labs. I've done that for 20 some years now. This was a whole other level that I could look under that microscope with the person in front of me and say, that's you. This is your cells. This is what is bathing your cells. These are organs that are not working well and it's showing up in your river of life. We got to clean that up. And it has been honestly, I love being a chiropractor, but I also feel like it was the next lily pad for me of helping people to another level.
Can I just slow you down a little bit? So you actually,
when you say fast,
but when you say live blood analysis,
Yep.
so you take some blood.
Yep.
Like not a whole lot. Don't be scared.
No, just a little poke of the finger.
But it's still alive. It's still moving.
Yes.
There's things you're seeing living cells moving
Absolutely.
around.
Yep.
And you're studying that. What types of things do you see when you're doing that?
Mm-hmm.
Because I don't know, but I wish we had slides or something. But
I should have.
So tell us what you see.
Well, yeah, you do see. So I have the live and the dried. So we look at both samples. The live, as long as it's bathed in its plasma, those cells are happy. They don't know any difference and they just keep doing their job. And so I get to obviously look at red blood cells, which is the most abundant cell in your blood. one of the most abundant cells, period, in your body. And, you know, obviously hearing Dawn's testimony, losing a lot of blood, yeah, it's a big deal, right? But your red blood cell health is the cells actually turn over in 4 months. So it's a really good window to be able to see in the last 4 months where people are at. The plasma is the fluid of the blood, and that carries things like heavy metals, microclots and clots, crystals, proteins, filaments, parasites, fungus, mold. These are all things that we can see. And then you also have your immune system in there. So you got all your brilliant white blood cells, which I think is always fun to watch people's experience of seeing their own immune system moving around. You know, you got different cells that do different things to keep you healthy. There's certain ones called neutrophils, and they're really like brilliant. They look like diamonds, but they move like Pac-Man through your plasma and they eat stuff. And it is so cool to watch. And I think even just that experience for people, you get this profound sense of like, whoa, I don't have to think about this. These cells are working on my behalf, doing their very best to try to keep me healthy. And you start realizing, I need to take care of my cells. It's my job to nourish them, bathe them in the right environment so they can thrive, because man, they're trying hard for you. So those are, and there's many things that you see as well. Like if you're doing well with, for instance, certain vitamins, minerals, protein, are you getting enough of the nutrients that are required to be healthy and alive and thriving and not just surviving? We've gotten to this point where, you know, people are so fatigued and so sick and so overweight, and disease is normal. And none of that is normal. It's not normal. So it's a really fun education piece to see your own cells. I think it helps people take action too, because it's like, whoa, that's me. That's me up there.
And imagine then in real time, you're able to do a diagnosis and basically make recommendations for people.
Yes.
So it's not like you're waiting for lab results coming back. You're right there.
Yep.
Perchance, could I ask you some stories, or like, I don't
Sure.
want to get you into too much trouble, just
I don't have to give names.
just a little bit,
Yeah,
but
yeah.
maybe share some stories just so people come to appreciate. There's this whole world out there in this natural health community where people are really finding relief.
Yes. There's so many wonderful stories. Like I love when I get to do rechecks with people and see where they're at. You know, one of my favorite things is just energy. That's one of the biggest concerns that people come into the office is fatigue and energy, and they just feel so tired. You can shift that a lot. And there's many ways to do it. B vitamins are a good place to start, and all of them, not just B12. Almost everybody knows that one, but you need all of them. So energy is one that helping people get that back, because when you feel better and you have more energy, you can do better in your life. You show up as a better version of yourself, right? So energy is a big one. Some of my favorite stories are around gut health. So very interesting to hear Dawn's story. That's another big, concern that I see in the office. So many people with digestive tract issues. And I firmly believe that has to do with all the chemical load, all the, just the junk in our food, the big pharma meds people are on, the glyphosate you mentioned. The food is just not the way it used to be. Like when I was growing up, I never heard of celiac and like gluten intolerance. Everybody seems to have that. And to me, I'm like, no, you have a glyphosate intolerance. Your poor gut lining is so inflamed, it can't even absorb anymore. So that's a really big one. So here's a great example. We talked about this actually when we, had our chat together earlier. I had a little girl come in my office. She's the youngest little girl I've ever checked. I do check a lot of kids, and she's under 2. And the amount of eczema on this child, it was like, I couldn't even, covered from head to toe in oozing skin that she just like, it was crawling out of her skin as we were checking out the family and getting them on their way. She even like just pulled down her underwear and was just couldn't, like, just she would do this at night not even knowing, to the point of bleeding. It was so intense, you guys. And I've seen lots of skin issues. But what people don't realize is that that's often related to gut health. because your innermost environment expresses itself. Your skin's your biggest detoxifying organ in your body. So what I found with her, and they were desperate, because I almost tried to talk them out of it, because I'm like, she's 18 months old. She's not going to like me poking her. I'm the person who doesn't like to cause pain at all. They're like desperate. They're like, we need your help. I'm like, okay, we got it. It's all good. She'll do great. And she did. But she had very, very serious leaky gut syndrome, which we can see in the dried sample with blood analysis. And it helped me to know a plan with her of what to do. Also loaded her up on D, because D is highly connected with skin issues. Highly. It's a hormone. And within 4 months, okay, and we did some glutathione with her as well on her skin. Like, we had a spray. Like, we did some really, basic stuff though. And the parents were very wise. Like, they were definitely on the train of like, we need to reduce chemical load. They were questioning some of the childhood injections. Like, there was some things happening because they saw some connections, right? But within 4 months, they sent me a picture of her, and it's like she's a totally different little girl. Her face, her skin was like healthy. It was beautiful. Yeah, I can't show you that picture necessarily. I'd have to get their permission, but just to know that she's not scratching herself to bleeding every night, and she can be a kid with her siblings and not be consumed with like crawling out of her own skin. So that was a really big one. That is like one of my most satisfying things to be able to help that family with. So that's a big one. And then liver health is huge also.
Which one?
Liver health. Woo.
Okay,
Ooh.
well, let's talk then about liver health.
Yeah. This is my belief, okay? Every organ in your body is perfect and brilliant, and it's there for a really important reason. I do think, however, I think your liver is your most important organ in your body. It is filtering and cleaning your blood. And then it does, in addition to that, about 500-ish functions, and people don't know this. It releases hormones, it releases bile, it releases glutathione. That's a big buzzword because of all the Tylenol stuff that's happening in the States right now. Glutathione is the master antioxidant in the human body, prevents your cells from aging. Okay, and I could go on about that. Your liver produces cholesterol, which is a very critical component to every single hormone in your body and every single cell wall. It's critical for your brain health, your nerve system. Every fatty tissue needs cholesterol. Woo, did they ever villainize that one? Okay, so, and I'm just touching on what the liver does. And most people have banged up their livers a little, whether it's intentionally or not. There's obviously some things that are much more intense on the liver than others. Big pharma medications, though, are some of the biggest. The third leading cause, actually, no, I think it's the first cause of liver failure in North America is Tylenol use. It kills your hepatocytes. Okay, and like, you just go and pick up a box and read the warning yourself. You'll be shocked what it just says right there.
And you have no warning in that it's happening. You don't know.
Yeah. So, the liver is also, though, on the other side, okay? And I, when I said just medications, but I'm even talking about, like, obviously food. People often forget the stuff we put on our body. 60 to 70% of what you put on your skin goes right in your bloodstream, people. So your hair dyes, your makeup, your skincare, right? Your soap, your laundry soap, what you brush your teeth with, that's going into your bloodstream, okay? And it's your poor liver that is trying desperately to clean that up. And then add maybe alcohol and drugs and all the things. There's a lot our poor livers handle over a lifetime. And the more we grow up and age, that liver's had that accumulative effects, right? But here's the deal. It's the most regenerative organ in the human body. You can take a chunk of it, donate it to someone else, it'll regrow for them and regrow for you. It's about that. Nothing other than bone regenerates like that. So it's by design. That organ is kind of designed to take a bit of a beating. Here's the other cool thing is that if you give it some love, I love giving love on my liver and I love on my clients' livers, it will bond and it'll impact all those 500 functions powerfully. So liver health alone and gut health alone, like those two things, oof, major in my practice. It's major, and it's major for me as well. I drink dandelion tea 3-4 times a week. It cleanses your liver. It's also one of the most anti-cancer things on the planet. Now, if someone needs an actual liver cleanse, ooh, that is so fun. So I had a gentleman come to me who had cirrhotic liver. Okay, he abused his liver for many years with alcohol. Had his blood labs, his liver enzymes were through the roof. It was not good, you guys. When your liver starts showing up with enzymes elevated on blood labs, that's a significant mayday from your liver, and your body is going down. It is not good. Okay, Don can attest to that, I'm sure. So he came to me and said, I need help. I don't know how he found me, and so I said, okay, well, they told you have cirrhotic liver. You have abused your body with alcohol. Okay, so obviously they told him you need to, get off the booze, which is sure, that's the first thing, get help with that, which he was getting help with. But I said, well, how did they tell you to heal your liver and support it? He's like, just don't drink. And I'm like, oh dear. So he got no actual active help to help his liver. He didn't know anything. So I did one of the most intensive cleanses I've ever done with anyone. I'm like, what do we have to lose? Like, I was looking at him, I'm like, he could die. Like, let's let it rip. So we did this whole protocol and, checked in with him. And yeah, it was mind blowing. After 4 months, he went back to do his blood labs, came to see me first. So I already knew what was going on with his liver, but went back to have blood labs, and his liver enzymes were normal. And his medical doctors were like, no, doesn't happen. So that's the power. But just because they don't study it and don't know it doesn't mean it doesn't exist. They also don't have a fundamental trust and ownership, which is where natural practitioners shine. We firmly believe that you have an innate intelligence that knows how to heal, mend, thrive, survive, overcome. You just got to support it, and it will express itself brilliantly. You're fiercely and powerfully made. That's the foundation that we believe. That's not what they believe. Because if they did, why would you put something in your bloodstream directly that, if you read all the ingredients and what they did, there is no way, if you just think about it for a minute, why would you put that in your bloodstream? In a beautiful river, Mountain Creek, think of a mountain creek. Would we go up there and just dump a bunch of chemicals in it? Because we could do better.
Our provincial governments will.
Yes,
Glyphosate.
that's right. That's right. But what's going to happen in that river if I dump a bunch of chemicals in that beautiful ecological system? Going to kill the fish, right? The grass on the side of the river is going to be damaged. Now we got the deer eating the grass. They're going to be damaged. The water downstream is going to affect the people. It doesn't make any sense, you guys. And it's like, we haven't stopped and thought, does this make sense that we do this? And that we could somehow improve upon innate intelligence, God, whatever you want to call it. It's literally, in my opinion, crazy. But I'm the crazy one, which bring it. I'll take the names all day long. I'm good with it. I got called some names today, and it's only Saturday. It's awesome. But it's just a really big difference going to a health and wellness care practitioner versus sick care and death management.
And it's a whole different paradigm. And I know that, chiropractic doctors and naturopaths and traditional Chinese doctors, they look at the whole person. And you've kind of mentioned that. If I can just share a story that struck me. So I'm interviewing a naturopathic doctor, Dr. Eric Arata, who, does a presentation for the show. And I asked, well, explain the practice of naturopathic medicine. Oh, we look at the whole person and, emotional and spiritual, all of this. And then I said, well, what were the most impactful patients? I learned, don't ask what their success stories are. Ask the most impactful, because that could be a disaster too, but there's something about it. And his first one was like a 10-year-old girl who shows up with her mom, just severe allergies. And the medical system was just being a total train wreck for them, which is why, the mother brought the daughter. And he says, oh yeah, well, I'm evaluating it. It's clear to me it's emotional. right? So he develops a protocol where, you know, it's motion. And I have to say, honestly, I was thinking, oh, this is sounding a little out there for me, right? and it, you know, I'm just being honest. So I ask him to explain, well, okay, so like how can this be? And he gives me an explanation. It's like, holy cow, of course this makes sense. He says, look at, you know, it was clear to me there was a really bad dynamic between mother and daughter's in fight or flight. He says, you know, your parasympathetic nervous system, if you're in fight or flight, if you're locked there, it's designed not to digest your food. And after, if you're in that locked there for long enough, you can get a whole bunch of inflammation. And she's got leaky gut and she's allergic to her foods. So really, it's an emotional problem. I have to solve that. And it worked. And it's just kind of like, okay, like we all know intuitively our emotions affect us. If we're not connected to God, it affects us, because that then affects our whole mood and our reason to be. Is we know it's off, we're off. We don't have that peace, right? And so it's not just nutrition. And the thing is you know, if we go to the government funded allopathic, which is there to treat our symptoms, not address who we are, not address how we're living, not to address our environments, not to address our nutrition. I mean, that's like, you know, we're on this journey, this walking journey. It's like asking a blind person to help us across the street. It just makes no sense.
Yeah.
You know?
That is so true. Yeah, you know, the emotions, you know, mind, body, spirit, it's all connected. You can't ignore that. You know, thoughts, I often say this to my clients and to my children, right? Thoughts become things. You bathe your cells in everything you think and feel. It's your hormones. So, you know, you talk about being in stress and fight and flight mode. I think that's one of the biggest things for people, because it actually connects all the pieces, right? It's your physical, your emotional, your spiritual, your mental. Because if I'm just in this mode of like, oh, wow, I've got lions chasing me, okay? And you're just like, could you imagine a little zebra trying to run for months and years from a lion? Like, how the heck are they going to feel? Like in nature, that doesn't happen with animals, right? Because either the lion eats the zebra and it's over, yeesh, right? But if the zebra gets away, the two animals are not dumb enough to chase each other for months and years, because no one's going to be able to forego that. But humans do it all the time. And then we're in jobs we hate, right? We have no passion and inspiration. We've lost our connection. You know, I really think that we're so disconnected from nature. Almost everybody's looking at screens now. We're the most connected we've ever been, but yet the most disconnected we've ever been. Like, people need to get outside. Get outside, you know, and look to nature for healing. You know, just breathing. People forget to breathe. Everyone's breathing right here, which is I'm being chased by lions, instead of like, I'm safe, I'm cool. Breath is medicine. Deep breathing can change your blood pressure and your heart rate. Just breath. It's medicine. People can be medicine, right? Surround yourself with good people medicine. Avoid the ones that are maybe the toxic ones. It matters. And these are the things that I don't think that gets that full view and look, and it matters. And how do you establish that in 11 minutes with your patient? And you get to talk about one symptom and one symptom only, people. It's really dysfunctional, yeah.
Right. So you're listening, because the natural practitioners, as I'll call them, are trained to actually spend time with you. And, you know, if you're in a job you hate, you know there's a problem.
Yep.
We do, right? If your social circle is toxic, we know there's a problem, and it's going to affect you emotionally, it's going to affect you spiritually, it's going to affect you physically.
Yep.
If you're not taking care of yourself physically, that's going to affect you emotionally, that's going to affect you spiritually. We're all connected.
We are.
And so, you know, if you don't have balance, you need to find it. And the natural health practitioners will help you find it.
Mm-hmm.
So that's the thing. It's not just physical, is it?
No.
Sometimes people come to you and they're expecting a physical solution, and you develop a protocol that has nothing to do with that.
100%. As a chiropractor, I used to call it the checkup from the neck up. Because when people would come in, like I would adjust them, but I'm like, whoa, like what's happening in their thought process? It's not good. We got to talk about this, you know? And even just, I think, loving on people and listening to people, it's so powerful. Because everybody is, I think, well, not everybody, shouldn't say that like that, but people are really yearning for connection and to be heard and understood. And that's, you know, something I think we can all provide for one another. Plus that one little nugget you might get from that person could change your whole trajectory of your life. Like when I got adjusted, that was it. And I'm so thankful every day that I got to go to chiropractic and learn about things I would never have known. I home birthed my babies in the water. I knew before they were born, I wasn't going to be putting chemicals in their little pure river. Not happening. I have 4 children. There's nothing in their bloodstream. They've never been on an antibiotic. They've never needed to. They've never had an ear infection. Do they have the odd cold or whatever? Yeah, and it's usually because they ate too much sugar, by the way. So when I call it flu, and you were talking about flu and cold season, agreed, it's low D season. It's also, we just had Halloween, and then we had Christmas, and then comes in Valentine's Day, and then comes Easter, and then comes, you know, like guys, it's just sugar, right, left, and center with children and us, right? So yeah, I can't believe the little things that I've learned along the way, and I'm so grateful for it because I am now impacting, hopefully, generations in my ancestry to come because of what I learned, because of one adjustment or one supplement or one moment at Health Matters. It could change your life. Hearing Dawn's story, you're here for a reason, listening to Shawn and Teresa, one little nugget and your life just went totally different trajectory. It's a beautiful thing. Yeah.
Yeah, no, Lana, I think, well, I think God has a destiny set out for each one of us. Yeah. And that if we don't follow that, we just don't feel right. Yeah. You know, you talked about being in a job you love and pursuing things. So it's just been a pleasure. It's been a pleasure to interview. I know I speak for everyone. We can just feel that you love people and you want to heal them. So let's give Dr. Lana a hand.
Thank you.
Thank you. Thank you for coming and sharing. So, so we're getting near the end of the evening. I hope that you can appreciate how important this is. So, you know, actually having people share their stories, actually learning about different healing traditions. What we're hoping is we're hoping that the word will get out and people that are suffering can come to understand, wait a second, there's hope. I don't have to suffer. There's a different way. And, you know, we are in this process where Health Canada is bringing in this new regulatory framework that is literally threatening our ability to access the nutrients that we need to be healthy. And, you know, even our right to choose. I hope I shocked you today in just sharing with you, you know, the reality in Canada that it's literally illegal to be healthy. Like, I mean, that's the box we're in, and this is important. So what we're doing is we've drafted a law called the Health Charter that solves the problems. And what it does is it just takes the health rights that the courts already say that we have, and it sets them out and says, hey, these are them. They're above all federal laws, and they're above all federal actions, and there isn't a subjective clause that allows the government to weasel out of them. And then it says, well, wait a second, we shouldn't have to be fighting for vital nutrition. Like, we shouldn't even be having this discussion. So it takes the regulation out of our natural remedies, for our vital nutrition, and it moves them into a Ministry of Wellness with a legal duty to protect and promote our access. Because government shouldn't be restricting. We should be absolutely free to be healthy. We should be absolutely free to decide how we're going to prevent illness and how we're going to treat illness. We all agree there can't be fraud, there can't be adulteration, things have to be manufactured in a reasonable way. But beyond that, you know, we so anyway, we wrote this thing, and we had a petition just calling on Parliament to pass it into law. We had that approved by the Clerk of Petitions. And then, you know, people in health food stores and individuals and stuff like that have been having people sign them. Well, we found out that we're the 3rd largest paper petition in Canadian history. Like, isn't that cool? So, we're over 150,000 signatures, and Judy in the crowd here, who's a volunteer, told me tonight, notwithstanding the mail strike, like we got another 3,000. And how many are sitting there in the mail? So what's it going to be like when we get there? But we're basically marching this charter and the petitions across Canada, holding events like this, and then another group starting in Charlottetown, PEI, and driving to Ottawa, and another group in Quebec City to Ottawa, and another group in Whitehorse. They refused to drive to Ottawa from Whitehorse. So we're letting them fly, and we're all meeting on Parliament Hill on October 25th. And we're presenting them to an MP that's agreed to enter them. And we're holding an event on Parliament Hill. I hope to see you. You're all invited. I hope to see all of you there. No, but don't laugh. You're all invited. Why not? This is history. And then we're having an event later that day, because the weather might suck on the hill, in Bikers Church. And that itself is going to be incredibly cool. So I do expect to see some of you there. But participate in what we're doing. If you don't subscribe, so our organization, these products are called Natural Health Products. It's just Natural Health Products Protection Association. So NHPPA.org. If you don't already subscribe to our newsletter, please do. We're the only group left standing trying to protect our access to natural remedies. We're the only group you can tie into that's going to tell you the truth and involve you in activity. So right now you can send an e-letter to your MP asking them to pass the Charter of Health Freedom. You can print off our posters, because this is an online event, so it doesn't matter that the Edmonton one is finished. We want people to participate. You can share that this is happening. I'm going to invite my wife Teresa up in a second to kind of share, how to do this. We've got, postcards. And when you see postcards in health food stores and you've already filled one out and you're there the next week, fill out another one, right? Like, just keep doing it. We have MPs have sent us photos, like of their closets filling up, and they're paying attention. And then they tell us this is the biggest issue on Canadians' minds. They do notice. So don't just do something once. And then also I'm inviting you to, to help us financially too. We're doing this to share with you truth. We're doing this to give people a voice. And, we have to pay for an AV team. We've got to stay in places. We've got to pay for venues and the like. And it's expensive, frankly. But we trust that we're doing the right thing, and we're just inviting you to participate. But we've got to blow this wide open. No longer can we sit and agree that we're going to be sick. One of our presenters is Dr. Michelle Perro, who's a pediatrician. She's been a medical pediatrician for over 40 years, but she also now is a homeopathic doctor. And she has shared that, like, basically 1 in 5, 20% of children in the US are chronically sick. Well, the figure will be the same for Canada. Well, that's happening on our watch. Like, our children are getting sicker and sicker and sicker, and nobody's looking into it because it's all by design. It's the business model, and we can't tolerate this anymore. So we can't tolerate Pharma Canada having control of our food supply. We can't have them telling us we can't have nutrients. So we have to build such a citizens movement that it's irresistible, because it's likely these policies aren't even coming within Canada. I mean, our government's been quite candid. We're a pan-nationalist state. Well, pan-nationalism means you're taking direction on important issues from outside of your country. I mean, this is in your face. I'm just stating it doesn't make sense to me that Parliament doesn't bring Health Canada to heel. What's the political downside in allowing us to have vitamins and minerals? what's the political downside in having a public dialogue on health policy where we're asking the question, how do we get good health outcomes? Like, there's no political downside. In the NHPPA alone, we can track in the last 20 months 3.1 million communications to MPs. There were only 338 of them. And, you know, over half of those paper communications, like literally they would send us photos of their closets filling up with these postcards. Well, they know that Canadians want the freedom to have access to vital nutrients. They know that we want our natural health practitioners to have access to the products that they need to help us. So why aren't they doing something? I don't have the answer to that. I have to say I'm totally, I totally don't understand. And, you know, maybe it's that the Privy Council, which is in control of our country, read our Constitution. You know, maybe we need to lobby there instead of Parliament. Maybe we need to lobby our King, which is our executive, instead of Parliament. I don't know, but subscribe to us. We're going to figure this out and do it, but there has to be more of us. And I think, you know, when Dawn's up here, she basically said, well, I didn't have a choice to help people, right? And clearly Dr. Lana couldn't not help people. And clearly Kim could not help people. And I think they're setting examples on, you know, you've got to catch that fire with us. And Teresa, do you want to just come up and share with us what to do? So this is my wife, Teresa. And and she wants us to sit down so the picture's framed better. But she's an amazing person. I had been involved with the NCI for 3 years, and everyone comes, oh, great work you did. Well, she set up and ran communications. And then after the first set of hearings, basically ran it until the end of the March hearings. So, you know, all of the admin and lion's share of the work. And so here at the NHPPA, we felt we needed to do this, and we're absolutely struggling. So I asked if she would come in and help, and she's basically coordinating all of this. And I'm just very proud. So there you go.
Aw. Thank you, Shawn. I just wanted to share with you the challenge that was placed on my heart when I agreed to help Shawn, even though I'm not actually sure if I signed the volunteer form or not. Probably not.
I signed it for you, hon.
So when we were volunteering with the previous, with another organization, people would come up to me afterwards and would say, what difference did it make? Like, where does it go from here? Like, and it really weighed heavy on my heart. Like, we're just two little mosquitoes here, and we can only do so much. But then the question always comes, what next? And then there's silence, because we don't know necessarily what to do. And I was really struggling with this. Fortunately, about 3:30 in the morning, I was woken up by my best friend upstairs. And he reminded me that I complicate everything. And he said, it's very simple. You just have to tell people to tell people. Full stop. We can no longer here take this information, sit here on an evening, digest it, maybe share it with some safe people that we know, that we won't feel threatened or attacked by sharing information. We can no longer do that because it hasn't worked. We have to tell people, and then we have to instruct them to tell people. If you don't like speaking with your regular circle, go talk to the person at Safeway. Because I guarantee you, they're suffering and they don't know why. They can't connect the dots. But when you speak with them, tell them to tell people. It's very simple. It's grade 10 calculus. It's exponential. If we just take it 3, look at the room here. I don't know however many people we have here. If we just went 3 deep, we're there. That's change. So I'm here to put everyone here on notice because I'm volunteering, even though I haven't signed the thing yet. And this is how we do it. And I have it on good authority that if we do it, it'll work.
And we'll end on that, but I just want to remind you we're part of something much bigger, and I think you all feel it. We've shared an experience here today, and what needs to happen is we need to share what we've experienced. We're experiencing truth. We're experiencing a revelation of truth, and we've come to understand that there are people really suffering because of the way as a society we've been trapped, and we need to become free again. We need to be free to stop suffering. We need to be free to be healthy, and we need to be free to make our own decisions. So I just hope that you appreciate you're not here by accident. You're here because you're being called to help participate in shedding light into the darkness. And with that, we will end for today the world's greatest health show.
Well, wasn't that amazing? Thank you so much. If you're still watching, I appreciate you being here. They're sharing some great information. Make sure to share this. As I said earlier, if you didn't hear this, but on the main website, NHPPA.org, you'll go to the live video, the live stream, and underneath there will be the recordings from each and every day, so you can watch back or share those. You can clip them and take pieces from them as well. So this is a great resource. Make sure to share this with your friends and family. Get it out to your social media. I appreciate you being here with Bruce Scholl on Unscrew the News. It has been an another amazing day, day 7 of the world's greatest health show as they cross Canada with the Charter of Health Freedom. And they'll be looking for more signatures for that petition. Also, they could use donations if you're willing and able. Please do. Also, you can just meet them at each of the locations. So look at where they're going to next, and maybe you can meet up with them and watch the show live in person. And I appreciate you being here. God bless you all. Thanks for being on watching Unscrew the News. Stick around. We're going to have daily. I try to do something amazing. Try to have some great people as well. Try to document these stories so that if we're not here one day, then the stories are already documented. And God bless you all. Keep your head on a swivel. Let's stay sane together. And this is Bruce, and I'm out of here. Thank you so much for watching Unscrew the News. I appreciate your participation in freedom in Canada. Share this information and help others to wake up. God bless.